So once there's irregular heartbeat, it will affect, remember that laminar flow we were talking about. Once there's irregular heartbeat, because as the heart is pumping, it's pumping blood into where? The blood vessels. So once there, next slide please. So now if blood flow in the arteries is affected, this can lead to atrial fibrillation, irregular heartbeat. Now, in addition to this irregular heartbeat, because the blood flow is irregular, it can now lead to slowing down of how the blood flows. And once blood is not flowing the way it should, then you have what? Like traffic within the blood vessels. And that can lead to what? Formation of a blood clot. Because it's just like if we're moving along the road. Sometimes you want to go from here to, let me say, Spa. And you just move. There's no traffic. You move freely, right? But sometimes you may meet some bottlenecks of traffic. And once you meet bottleneck of traffic, there is now opportunity for bumper to bumper, right? And that in itself is now like a clot of cars. So, okay, what happened to the... Alright, but I can still go ahead. I hope everybody is with me. Alright, so now when atrial fibrillation occurs, that blood clots in the artery can affect different organs. And the two main organs that are involved are either the heart or the brain. So if arterial blood clot occurs in the blood vessels supplying the heart, that is what is called myocardial infarction. A layman's term is heart attack. So somebody is there and suddenly just has sudden chest pain, holds his chest or her chest, drops to the ground. Sometimes if an ambulance can come, the person is gone. That is a heart attack. Caused by what? A blood clot in the artery. The other type of arterial blood clot is a blood clot in the brain, and what we commonly call what? Stroke. So if this clot happens in the brain, we already know how somebody with stroke is, right? It depends on the part of the brain that is involved, and this will bring about the clinical features that we'll see. Maybe the person cannot walk, or is limping on one side, or one part of the face is paralyzed, or the person may not even be able to speak anymore. These are all symptoms of stroke. Now, that is for arterial thrombosis. The other type of blood clot is venous thrombosis. Venous thromboembolism okay, previous slide. Okay, so we talked about this. So what I forgot to mention is that there are certain things that can predispose to arterial blood clots that will lead to atrial fibrillation. And two common things there, hypertension and diabetes. Those are two common conditions in our environment. So you can imagine that almost everybody that is hypertensive, when the blood pressure is not being controlled, because if the blood pressure is being controlled, then this risk is less. But if the blood pressure is not being controlled, then the risk of arterial blood clot is there. The same thing with blood glucose not being controlled in people who are living with diabetes. Okay, next slide. So venous thrombosis, and I will dwell more on venous thrombosis because that is what concerns me as a hematologist. So when we talk about venous thrombosis, venous thromboembolism, permit me to say VTE from here because the name is long. So in the first, we can see three blood vessel pictures there, right? So in the first one, there is normal blood flow, and then blood is going, there's no problem. In the second one, a clot has formed, and you can see that the clot is on the wall, on the blood vessel wall. Okay? That means that thrombosis has already occurred. But now, when you say embolism, embolism is the third picture. What has happened? A part of that clot has been cut off and then is traveling in the bloodstream. That is the danger. That is actually the danger. In the second slide, if the clot forms and it just remains there, it's not going to be really much of a problem. There may be pain, there may be swelling and all that. But the problem, the risk, the death risk associated with VT is from this embolism. Why? Because as the clot which usually forms in the leg. You can see there's a picture there in the leg. It can take place in any other part of the body, but the commonest site is the leg. It can be the lower part of the leg or the upper part. Now, once that clot dislodges and is going up, where is it going? Remember, deoxygenated blood is going back to where? To the lungs. So that clot is going to dislodge and travels where? To the lungs. And a lot of the time, depending on the size of the clot, could be that that clot goes to block where its blood flow should enter back into the lungs. And what's going to happen? Difficulty in breathing, sudden chest pain, and that's what we call pulmonary embolism, which, if not rapidly taken care of, can lead to what? Instant death. So pulmonary embolism is a cause of sudden death. Myocardial infarction is a cause of sudden death. And that is why we are here, because thrombosis is no good. Next slide, please. So when we say VT, VT is a mixture of two things. The clot in the leg is called the deep vein thrombosis, or wherever it occurs. While pulmonary embolism occurs when the clot has dislodged from wherever it was formed and transferred to the lungs. Next slide, please. So this is a summary of what I just explained. It's a pictorial diagram, so we can see how the blood supply from the legs can go to the lungs to cause obstruction. Next slide. So what is the problem with thrombosis? What is the problem of blood clots? The first problem is that blood clots can affect anybody. It doesn't look at face, it doesn't look at race, it doesn't look at size, it doesn't look at age, it doesn't look at anything. Blood clots can affect anybody. So don't think that I am not affected. It's not me. It cannot happen to me. Not that we are saying it will happen to you, but it is for us to be what? Aware and conscious to know that blood clots can occur to anybody at any time. That is the first problem. That means that, are we all at risk? Yes. That's what it means, that we are all at risk. That's the first thing. The second problem with blood clots is that in up to 50% of cases, they don't cause symptoms. So remember the clot we were talking of in the leg. When the clot forms in the leg, in up to half of the people that have blood clots in the leg, they will not have leg swelling, they will not have leg pain, they will not have, like change in the color. If you are a bit lighter skin, you may notice that that place is looking a bit darker compared to the rest. So that means, how will you know that a clot has formed, right? That is the danger. And if you did not know that there was a deep vein thrombosis, the problem now is that on its own, the clot there can dislodge and now cause pulmonary embolism. That is when the patient will present. And sometimes it's already presenting dead. That is the problem. So it is what? A silent killer. And the other problem there is that this thing, most of the time, is preventable. Therefore, if we know that it is preventable, the onus now lies on us to prevent blood clots and do what? Keep life flowing. Next slide. Okay, so I hope we can see the pictures. Okay. So the first person on the top left is who? Hillary Clinton. Do we know that she's how will I put it? She's a recurrent DVT patient. She has had DVT several times. Now, the first time that she had the DVT, wife of presidents, and then also the political life that she lives. So she's always doing what? Traveling. So they related the risk that she had to continuous long distance traveling. Okay? And then if you look at it, she's about 50. The risk for DVT, we said it can occur at any age, but the risk increases with older age, and especially above 50 years. So when you look at it, okay, Hillary Clinton, okay, because of her lifestyle and then her age, she's predisposed to blood clots. We can understand that. Does anybody know who the second person is there? Up right. Heavy D. I think so Heavy D was a rapper. Was in the sense that he is no more. And what happened with Heavy D? He was found dead. And when they did an autopsy for him, they found out that he died from what? Pulmonary embolism. So he had a previous DVT which was silent and he or nobody knew about it. This is what we're talking about, what? Silent killer. And if you look at Heavy D, his name alone tells us that he was obese, he was on the heavy side, right? And that was part of his stage name, Heavy D. So obesity in his own sense may have predisposed him to having a blood clot. But what I want us to take from there is that he didn't have symptoms relating to DVT, but he was found dead. So that's what we're talking about, silent killer. Now, Serena. Everybody knows Serena Williams, right? Greatest of all times. Serena lives an active life. Is she up to 50 years? No. Now, Serena's first blood clot, when I say first blood clot, that means there was a second one, right? Now, Serena's first blood clot, also remember her lifestyle. She's traveling from here to there to go and play one game or the other, right? So her first blood clot happened immediately after a journey. She was traveling, I think, from California to New York, and as she landed, she suddenly developed breathlessness. And when she developed this breathlessness, they rushed her to the nearest hospital, and that was where they found out in doing CT scan and all that. They found out that she had a pulmonary embolism. It was then that they checked the legs and found out that she had a silent deep vein thrombosis. Now imagine if she had landed and there wasn't immediate help and immediate diagnosis. We may have been telling a different story. Fast forward a few years later, the first DVT happened before she got married, before she had her daughter. Fast forward a few years after, she gave birth to her daughter. And immediately after giving birth to her daughter, she developed breathlessness. Now, when she developed breathlessness, now she's at home. The other time she traveled, right? So she was in a different city, but now she was giving birth at home. So immediately she alerted her doctors and said, look, it's like I'm having another pulmonary embolism. They said, no, it's the stress of labor, the excitement and all that, you're just feeling breathless. She called them back and said, look, I'm talking like I was there, right? She called them back and said, look, this is similar to the symptoms I had after my first event. And it is interesting to know that somebody who has had a blood clot before is more at risk to having another blood clot than somebody who has never had. So she was quite knowledgeable to the fact. And because she insisted, they did another scan for her and found out that yes, she was having a repeat pulmonary embolism. And that is why knowledge is very, very, very important. So Serena, she was in her early 30s when she had the clot. Does that really classify as a risk? She lives an active lifestyle. She's not obese. So when you look at it, what could have been? The question is if Serena has an inherited risk for having thrombosis. Next slide. Okay, so some little statistics there. Every year, this statistics is from United States. Every year, about 60,000 people die from blood clots. Women are more affected than men. Why? Because in addition to all these other risk factors that both males and females have, women also get pregnant, right? And that adds an increased risk. And then things related to hormones are also more common in women. So women tend to have more. But does it mean it doesn't happen in men? No. Then you will see that I've already said it, less than 50% of those who are diagnosed do not have any symptoms. And then about 1 in 1,000 pregnant women will have a deep vein thrombosis. And each minute, somebody dies from DVT. Next slide. 1 in 4 people that die from diseases related to clot formation. 1 in 4 people. And this is, even if you have road traffic accidents, HIV, communicable diseases and all that, this is higher than all of them put together. This is how important blood clots are. And then we know that one of the top 3 causes of cardiovascular diseases are related to clot formation. VTE is the number 1 preventive cause of hospital-associated VT. Death. VT is one of the VT is the number 1 cause of preventable hospital deaths. Preventable hospital deaths. And I looked through the brochure and I saw that you have a topic on that today, so that is interesting. And then 60% of VTs are associated with hospital admissions. So it means that even we that are seated here, we may be admitted for one thing or the other. If for any reason we have to be admitted, or our loved ones, we must find out if we or that person that we love is on admission needs to have protection against blood clots in form. Next slide. So, what are the chances of developing a blood clot? Everybody that is sitting here, you take your lifespan and put it all together, everybody has a 3 to 5% chance of developing blood clots during your lifetime. That's, if you turn it the other way, it means that you have a 95 to 97% chance of not developing a blood clot. Is that not what it is? Let's look at the good side now. Is it not? So we have a 95 to 97% chance of not developing a blood clot. But what about that 3 to 5%? We can't ignore it, because God forbid that 3 to 5% will be the cause of instant death. Now, the other thing is that about 1 in 1,000 people have that risk to develop a blood clot. And like I said before, if somebody has developed a blood clot before, just like in the case of Serena, just like in the case of Hillary Clinton, that person is more likely to develop another blood clot than somebody who hasn't. Isn't it interesting that I didn't have any prominent or popular Nigerian to use as an example for somebody who has had a VT? Why? Because a lot of the time, every disease we associate with stigma. Is it not? Every disease we associate with stigma. And so we don't want to come out and say that this is the problem. So unfortunately, in as much as I used foreign personality to illustrate this, let us know that here in Nigeria, we also have VT. So don't look at it like it's a foreign disease. Next slide, please. So, how does a clot come about? Today is World Thrombosis Day, and the president has already said that. The day was set aside to create awareness about blood clots, right? And this date was chosen to celebrate Rudolph Virchow. That was his birthday. So this day, October 13th, every day is World Thrombosis Day. Now there are 3 things that we look at when we are talking about increased risk to developing blood clots. One is that, is there blood vessel injury? If there's blood vessel injury, developing blood clots. Immobility, and then hypercoagulable states. So what are hypercoagulable states? Remember the blood coagulation factors that are circulating in the plasma. Anything that increases their concentration or reduces the concentration of things that normally help to anticoagulate blood, like the natural anticoagulants, which we know protein C and yes, can also lead to that. Next slide, please. But there are several things, one, smoking, alcohol, but there are more important things also, like immobility. Now, immobility, in as much as we said long distance travel, especially if you are traveling for more than 4 hours, how many of us enter our offices and we sit for 4 hours or more? Am I the only person? Am I the only person? No, all of us. We enter the office and then we balance. Or we enter meeting and then we balance. Or if there are students here amongst us, you enter the class and then you sit down. It's the lecturer that is going in and out, but the student remains seated. We're having this World Thrombosis Day celebration today. Some of us, yes, let's meet. Some of us that have come in this morning now will remain seated until they say it's time to share food. Then we get to work. By then, 4 hours would have passed. So you find out that a lot of us may be living a sedentary lifestyle, and that is where immobility comes in. Because if you are doing that recurrently, day after day, then it increases the risk of developing a blood clot. Pregnancy is also a risk. Certain diseases like cancers, certain drugs like estrogen-containing pills, all these are risk factors that could predispose somebody to forming a blood clot. And then age. The older you get, the more likely that you could develop a blood clot. Now, if you look at these risks, there are certain risks that we call modifiable, and then there are certain risks that we call non-modifiable. So what do you mean to modify, to change? Something you can do something about. Is age a modifiable risk factor? No. Okay. So I then saw me this morning and said, this woman, you have refused to age. So forget that I'm looking fresh. My body knows how old it is, right? Yes. So some people look younger than their age. Some people also look older than their age. But the body's physiological mechanism knows what age it is. And irrespective of how you are looking, everybody is aging every day. And the older we get, that's 3 to 5% that we are not paying attention. Remember that risk that we are not paying attention. The older we get, the more likely that 3 to 5% may occur. So age is very important. Next slide, please. Next slide, please. These are still talking about risk factors. So, what does a blood clot look like? Next slide. The first thing is that a blood clot may be asymptomatic. Remember that I said it's a silent killer, right? So in up to 50% of people that have a blood clot, they may not even have symptoms until they now come down with maybe a sudden myocardial infarction or a sudden pulmonary embolism that can kill the person. And please, it's not jazz. Because that's the first thing we say, not jazz. Is it not? Okay. Now let's go to the next one, which is jazz. So I had somebody, not even one person, I've had several people. Next slide. Can we see that? Legs swelling. I don't know if it is still there, but the leg on the right. The patient's, okay, on my right, that is your left. Yes. One leg is swollen and the other one is not. So a lot of people that have DVT, do you know what they say when they have DVT? That they matched poison. It's not matching of poison. It is DVT. Okay? It is DVT. I've had somebody in my church. I noticed he was walking with a limp. And I think I met him. I said, sir, what happened to your leg? He said, I matched poison, I said, when did you match the poison? He said that they kept it for him by the side of his bed. So that morning, not the morning I was talking to him, the morning that he noticed it a few days before, as he got up and he stepped down with that right leg, that was where he kept the poison. And since that day, he had been having difficulty. Of course, I already had a suspicion of what it was. So I said, sir, please, after church, come and see me. I want to really look at this your leg. And long story short, when he came to the hospital, we did a Doppler for him, and he had a DVT. That's what he had. And once we started treatment, everything resolved. And so what happened to the jazz? The jazz was now modified. So knowledge is power. Because I even thank God that Then few days after, they kill her. Because that is our environmental thinking and it's bad. So leg swelling, that swelling may come with pain, that swelling may come with, you know, some kind of redness or discoloration of that area. If we touch that area, we notice that that place is hot or warm compared to the other leg. And the swelling is usually one leg. One leg. So it's a unilateral leg swelling. If both legs are swelling, then it could be other things that are causing it. But when it is one leg, please let's think of it. It could be us, we don't wish so. It could be our loved ones, we don't also wish so. But we must have this knowledge so that we know when to act. Next slide, please. The other way a blood clot could form is, you can see his face. One side is drooping. He has had a stroke, right? Remember we talked about arterial blood clots. Next slide, please. So sudden chest pain, sudden breathlessness, sudden difficulty in breathing, hold the chest tight. It could be a myocardial infarction. It could also be a pulmonary embolism. One is arterial, one is venous. Both of them can lead to what? Sudden death. Next slide. Okay, recurrent miscarriages. Let me give you a real life story again. I have this friend, we were in medical school together, and when she got pregnant, after about 5 months into the pregnancy, she lost the baby. So everybody was sad about it. About that period was also her white wedding period. They had done the traditional wedding some months before because the husband was coming from the US. So everybody now said, oh, it's the stress of planning wedding. That was how many years ago? That time there was not Instagram and event planner. If you are married, you have to enter a bar and plan your wedding yourself. So they said, oh, the stress of the wedding, you know, all that stress. She lost the baby. Okay, so no problem. Wedding went on. Some months after, we were now in the 5th year. The first one happened in our 4th year in medical school. The next year, 5th year, she got pregnant. Now when she got pregnant, the pregnancy went beyond 7 months. In fact, at 7 months, we now went to my ward, started buying baby things with her. We were all very excited because this was a real life friend becoming a mother. But long story short was, just before the 8th month or about the 8th month, she lost the baby. So everybody was sad, and then by then we were getting to final year. So she said, oh, she's not taking it again until she finishes her final exams. When we were doing our internship, she got pregnant. As she got pregnant, not long into the pregnancy, she went to the US. And then, not long after, we found out that she had given birth to her child. And everybody was happy. And what was the story then? Juju know they cross water. Yes, because she had two pregnancies here, and she lost them. But she went abroad now. As soon as she found out she was pregnant, early 2nd trimester, went abroad, and she safely carried her pregnancy to term and delivered. Is it not true? So again, our environmental thinking. Now, why am I bringing this up? When I entered haematology, she now called me and said, she's very happy. I will now be her doctor. I said, how? She said that, do you know that when she went to the US, they diagnosed her as having protein C deficiency. So all they did was put her on anticoagulants for the rest of the pregnancy, and she had her baby. And she has had 3 children now. That first child that we're talking about is 21 years old. And she has had her 3 children because of what? Knowledge. And it now took us back that when she lost the 2nd baby, they did autopsy on the baby and also on the placenta. And they found out that there were multiple blood clots in the placenta. What is the function of the placenta? To supply oxygen and nutrients to the baby. If there are blood clots blocking everywhere, how will the baby have the oxygen and the nutrients? Why will the baby die? So that woman that we are saying is killing her babies, she cannot carry Pikin. Of course, there are many causes of recurrent abortions, that's spontaneous abortions. But what the causes that we sometimes forget to look at is a woman may be actually having blood clots. Remember that we said that it is not only in the legs that blood clots could happen. Next slide. Okay, so how do we identify blood clots? Next slide. So in the lab, what do we do? There are two essential tests for us to identify. One is a D-dimer, and then two is to do a Doppler ultrasound scan, just like we see in the picture, the lower picture here. So we know how a scan works. They do the scan for the veins in the legs, and then a D-dimer is done. And in DVT or VTE, or when there's a blood clot, the D-dimer concentration is usually high. And when a pulmonary embolism is suspected, then they can do angiogram in chest. Next slide, please. Next slide, please. So how do we treat patients that have a DVT? Those that have been diagnosed, you can give drugs. The drugs may be through injections. The drugs may be through oral tablets that can be swallowed. Sometimes they are giving, yes, look, next slide. Sometimes they are giving compression stockings to wear. So we can have treatment using medications, or you can have treatments that don't use medications. Now, the other thing that can be done for these patients is, if you look here, there's something like a basket. Right? Can you see that? It's called a filter. Because there are some people that maybe you cannot give them drug because of the condition that they have. So in those people, you can insert this filter into the vein. And what does it do? It will prevent clots from passing there to embolize to the lungs. You can also treat with surgery. Next slide. Sometimes a surgery has to be done, manually remove the clots, but most of the time it's drug treatment, use of compression stockings, lifestyle modifications as applied. Next slide, please. So what is the outcome? The outcome is that 50% of people who have deep vein thrombosis will have what? Pulmonary embolism. And then out of these 50% that have pulmonary embolism, up to 50% of the people that have pulmonary embolism may die from the pulmonary embolism. So that is what makes this very, very, very important. Next slide. Okay, so how do we keep life flowing? That is the question. How do we keep life flowing? We have said that blood is life, right? That's what we said. So we can switch it. If life equals blood, is there any mathematician here? So we can switch it and say, keep blood flowing. Is that not it? Yes, because we want to keep blood flowing without any obstruction of a clot. And if at all a clot formed, then we want to resolve that clot immediately so that blood can continue flowing. That is why we are here. So, World Thrombosis Day, October 13th, is a day that we use to remember those and celebrate those who have survived a thrombus. Also remember those who did not survive a thrombus. Some of you did not know who HBT was before I started this lecture, but now you have known him. You can even Google and search. So such things. And then to create awareness. To create awareness, by the time we have gone through today's session, we would have learned so much. But when we create that awareness, when we've learned that much, it is not to keep it to yourself. Because if you keep it to yourself, then we have not done much. It is now to imbibe it, practice, and then influence those around you also to keep blood flowing. Next slide. So for us to keep blood flowing, we now have to pay attention. That means we should not allow blood to clot. Is that not it? If we want to keep blood flowing, that means there should be no slowing. Because once we slow, once blood flow slows, that means that a clot can form. So to keep blood flowing, it it means that we should have preventive measures. And for us to have preventive measures, first of all, we must attend to ourselves. It's like in an airplane, it's when those things that what do they call them? The hostesses, yes, what they announce. They say in the case of sudden cabin pressure, then in our mind we say, God forbid. Then they say, oh, first of all, wear your own oxygen mask, right? Before you assist another person. Yes, it makes sense. So first of all, we here, how do we keep our own blood flowing? Then we can now talk about how we can help to keep other people's blood flowing. Next slide. So what can we do? The first thing is that we must know our risk. I think earlier on we've determined that all of us are at risk, right? Did we say so? So if all of us are at risk, it means that we should be conscious to always prevent VTE. And in the event that any one of us has to go to the hospital for anything, sometimes it must not be a bad thing. Even going to hospital to give birth, is it not good news? It's good news. So it's not only bad thing that carries people to hospital, but for whatever reason that we need to seek medical attention, especially if it requires hospital admission for up to 3 days or more, we must speak with our doctor that, no, please, do I need to prevent clots? Is there anything that further predisposes me? Because your doctor can assess you to know whether you need thromboprophylaxis to prevent clot or whether there is no need, depending on the situation. So we must know our risk. We must know what to do if we're in the hospital. We must know how to communicate. And then if in the event, even if you are not in the hospital, if in the event you wake up one day and you notice that, this my leg is swollen, oh, this my calf is painful, oh, don't say you matched poison. What should you do? Go straight to the hospital. Or you notice that sudden chest pain, you rush to the hospital. Next slide, please. So there are certain things that we can do to help reduce the risk. It did not say eliminate. You cannot completely eliminate the risk. But maybe that 3 to 5% that all of us had from the beginning, you can reduce your own to 1% or 0.5%. So the first thing is live an active life. Live an active life. Some of us, after sitting in the office from morning to night, then when we go home, we balance on the couch, right? Then you call your first son, bring this for me. You call the maid, bring that for me. You are sitting down from morning till night. Then when you finish that, you go and lie down on the bed to complete the lie down. So how long exactly, if you count it, are you spending on your feet? So living an active life is very important. Exercise is very important. Exercise, when I say exercise, I don't mean go and carry big weight too. I don't mean go and register in gym. That's not what I'm saying. What is exercise? It's just a random, conscious movement of the body. Conscious, that is, you know what you are doing, right? Repeated movement. So you can just decide, brisk walk. Brisk walk is the best form of exercise for everybody. Because so far as you can walk on your feet, you can do brisk walk. And what is brisk walk? Brisk walk is, if normally this is how you walk, brisk walk is walk a bit faster than how you normally walk. Just time yourself for 30 minutes. And you know an easy way to do it. Don't go and run on the road before you say kidnappers came. Just in your house. What's your favorite program? What's your favorite program? Tell me now. Telemundo things. We know them. So there may be a program that is about 30 minutes. While watching that program, stand up and watch it like this. That's all. That's your exercise for the day. And guess what? Because you are so interested in that program, you won't even realize when 30 minutes finishes. Is that not better than lying down to watch it? Especially because a lot of us here are health professionals. You may not have the time to get up in the morning, do exercise before you go to work, and so on and so forth. But if you make it a conscious effort, it doesn't even have to be every day, but at least 3 to 5 times in a week. Then our diet. Remember we talked about hypertension, we talked about diabetes being predisposing risk factors, right? Especially for arterial blood clots. So what are we eating? If you have foods that are so rich in oils and so heavy in carbohydrates, incidentally, a lot of our Nigerian foods are heavy in carbohydrates. It doesn't mean that you should not eat gari. It doesn't mean you should not eat rice. What it just means is reduce the quantity a bit and then increase the quantity of vegetables and fruits and proteins. So it's just a portion control. It doesn't mean you will not eat it, okay? And there are other things you can do. For example, stop smoking. Reduce your intake of alcohol. It doesn't mean you should not take alcohol. Just reduce the intake. So if you go for a party and then maybe champagne is being shared, you can take a glass. Not a problem. But if you have to go outside every day because you want to drink beer, then there's a problem, because it can predispose you to clot formation. Next slide. So, if we have been sitting for up to 90 minutes, we must make sure that we get up and move. This helps in preventing blood clots. How will you know if you've been sitting for 90 minutes? It's difficult to count, right? So the easier way to do it is to tell yourself that within every hour, you must move for at least 1 minute. So if, for example, it's 10 o'clock, okay, have I gotten up from this chair in this 10 o'clock hour? Then the next time now is 11 o'clock. Have I gotten up in this 11 o'clock hour? And so on and so forth. But sometimes you may be where you cannot get up. So if you are where you cannot get up, what do you do? Right where you are sitting, you can actually mobilize your legs. One, you can swing. If you swing, you have mobilized the leg. The second thing is you can draw circles. So you draw circles this way, and then you draw circles in the other way. Can everybody see my short leg? My leg is not so long, but I hope that everybody can see because I was Victoria. Yes. So draw circles. Okay, I think there's a picture of the next slide. Okay, so this is talking about sitting disease. Sitting disease. So sitting is actually now a disease. Sitting for prolonged hours in a day predisposes to several things. Number one, we can see deep vein thrombosis here, right? But even apart from deep vein thrombosis, the heart disease that can lead to arterial blood clot, that can lead to arterial blood clot is also there. And then if we look at the other side too, you can see that sitting gives you unhealthy blood glucose level. So the diabetes also that we are talking about that can lead to atrial fibrillation, again, is here. So there are so many things that sitting causes. Next slide. And of course, obesity, which is also a risk factor for VTE. So these are just ways that we can, sometimes you are in a meeting, or for example, in that plane that is traveling for up to 4 hours, but the seatbelt light has been on, so you can't get up and move anywhere. So what do you do? Right where you're sitting, swing your legs, draw circles, lift up, press down, lift up. Do that repeatedly, a few minutes in an hour, and then you'll be fine. Next slide. So this is still all about leg movements. Next slide. So after talking about how we can take care of ourselves, we can now talk about how do we take care of others. First thing is this awareness that we are creating today. Is it not a good thing? Because people that have benefited from awareness programs will have more knowledge about what we are talking about. Our next challenge now is to take these messages to the streets. Because a lot of us here are health professionals, so we're already thinking in the health line. But what about that man on the streets that will still say he matched poison? So I'm also pleading, Mr. President, sir, because you already said you are looking forward to next year's World Thrombosis Day in your opening speech. I'm also pleading that it could be a radio awareness program. It could be physically going. You could just decide even to go to UST Park here, the car park where the taxi men are. you meet a lot of people that don't know what you're talking about, and you will be able to educate. It's better to educate one person out of 1,000 than not to educate at all. So we'll continue creating these awareness programs whenever we have the opportunity, and sometimes even when there's no opportunity, we create the opportunity for the awareness to take place. Next slide. The other thing we have to do as health professionals is one, we're involved in diagnosing patients that have a VT. So sometimes it will be in performing tests such as the D-dimer, even factor assays, even estimation of coagulation proteins, for example, protein C, protein S, and so on and so forth. Then, in addition to that, after diagnosis is made, also monitoring the patient. Because a lot of the patients that are treated will require monitoring with either the prothrombin time, INR. Sometimes other drugs may require monitoring using anti-factor 10A assays, and so on and so forth. That is our primary role as health professionals in diagnosis and monitoring. Then, the other thing is training and retraining. Training is very important because what you knew 5 years ago, it may not be the same now. Medicine is ever evolving. So don't think that, hey, I know it now, they've already taught me, I learned it 5 years ago. No. There are even some things that you know today. Just last year, you see that, there are some things you knew last year, but check it, go back to update yourself on that knowledge. You find out that within 1 year, there's so much change in the knowledge on that particular subject matter. So we must continue to train and retrain ourselves and those who work for and under us. If you are in a headship position, make sure that your staff are able to attend workshops, seminars, and so on and so forth to continue to get updated on current knowledge. The other thing is teamwork. Because at the end of the day, when the patient comes to the hospital, it is all about teamwork between the healthcare professionals to be able to manage this patient from the point of diagnosis to treatment. Next slide. So, in summary, I think I have been able to tell us how we can actually keep life flowing. I hope I made some sense. And we can see that for us to keep life flowing, whose responsibility is it? It's our responsibility. It's our responsibility. So you must first take care of yourself to make sure that you have kept your blood flowing before you can now check whether you can keep the blood flowing for your neighbor or partner. Thank you very much.
Please, another round of applause for her. Please, ladies and gentlemen, that was a very wonderful presentation and a keynote address. If I were you, I would once again put my hands together for her. Thank you. We'll take a few questions because she has to take her leave. So let's welcome a few questions. Wow. Somebody just want to say wow. Wow. This is it's not just a professional teaching, professional, everything put together. You cannot have it like this. I bet. This is down to earth. Professor, thank you for this very insightful. I expected, let's look at this for that. I expected my postgraduate students to be here. In fact, I was telling somebody that if I have any topic that has to do with thrombosis, I will teach it again. Because I expected them to be here to get this lecture. There are things you get in a workshop you cannot get in a class. what we're going to receive in this workshop for these few hours can be a semester work. So for students who did not take it serious, I don't think you, but maybe the only good thing is that this lecture is on YouTube now. So you can always go back and watch it. So, but NSP, Professor, I am so happy that I'm here. I listened to your lecture and very, very excited. Can we give her another round of applause? So we will not, I told you earlier that she has a program at Uniport and she'll be leaving us, but I know your spirit will still be here. So because of that, I will allow us to ask her a few questions. And to moderate that section, I want to invite another wonderful person who was here with us last year. That was 2020. He also was a resource person in this Thrombosis. We are going to be having this every year until all of us heal this Thrombosis. So I want to invite Professor Hannah Ogunakwe to handle this session. She's a professor of hematology, consultant hematology, head of department of hematology in this same university. Put your hands together for her.
Good afternoon, everybody. Thank you so much, Professor Corwell, for that very excellent lecture, very down to earth. So I'm sure you've learned one or two things, or many things, as Professor Jeremiah has said. Do you have any questions? We'll just take questions. Maybe we'll start from this side. Thank you very much. Do you have a second mic, please? Okay, so this is one. Any other person here? Okay, and then 2, 3, and that's it. Thank you.
All right, thank you, Prof, for that very wonderful and very interesting lecture. I have two questions, basically. The first one is, what hormones do you look out for? When you are talking about some hormones that can be affected, what hormones do you look out for? That's one. And then what proactive diagnostic screenings can we do? You know, like you said, these things are things that are not are very silent. You know, they're creeping on you. So just like you can do your A1C for like you do. Those are proactive screenings that you can do. What kind of proactive screening can we do for this particular thrombosis? Then the last question is, what predisposing drugs? You didn't actually mention any. What predisposing drugs do we need to look out for that would help in that would increase our chances of having thrombosis if we are not careful? So
I think we'll take the question together.
Take over.
Who's the second person, please?
Sorry, please. Your first question was
I said, what are the hormones? What are the hormones? The hormones that we look out for. You know, you can, as a proactive measure, you can just say, okay, let me just check these hormones, to see that if they are increased, that means it might be pointing to this, Okay.
Second person.
Thank you. So my people that are asking questions.
thank you, Prof.
A lot. But there's something more I want to know. You talked about us taking care of ourselves and also taking care of others. You also talked to us about deep brain. Okay. Now, how does I want to talk with this move? Do we have
Prof, do we have conditions where we have these embolus move? Does something drive it? Are there conditions that drive it, that suddenly they move from their primary position to a secondary position? What causes it? Because I'm really surprised that, you can just move from a kind of permanent site to another site. So what really drives it is what I want to know. Thank you.
Mainly before it moves.
Okay, thank you very much for your questions. I'll take them in the order that they asked. So the first question was hormones involved. So, the first question was hormones involved that can lead to increased risk for VTE. So it's usually estrogens. Estrogens, when they are increased, can predispose someone to having a VTE. And that is why when we talked about drugs also, we talked about estrogen containing pills. I think I mentioned it as one of the things that can predispose. So women that take the pills, or even women that are on, when menopause occurs, sometimes they do hormone replacement therapy with these hormones, and that can increase the risk for VTE in these people. Then for screening tests, so it's not like there's a particular screening test that you can come and say, let me do this and know whether I have VTE. However, one, you see that my friend that I was talking about, that later gave birth to her child. If I were her, all her children would be screened for VTE. Why? Because there's a familial tendency. It doesn't mean they will have it, but at least as she has already been identified as having protein C deficiency, at least that particular one should be screened for her daughters. That is how screening can be done. The other thing is that sometimes D-dimer can be used to screen, but it's not like it's used routinely. It's usually used, for example, you are suspecting could this person have a DVT, you are not sure. So maybe after you've assessed the person, then you want to do a D-dimer, because if the D-dimer is elevated. But we also remember that D-dimer is not, it's a sensitive test, but it's not a specific test. Remember we talked about pregnancy. Pregnancy will increase D-dimer levels. Obesity increases D-dimer levels. COVID increases D-dimer levels. Severe acute inflammatory processes will increase D-dimer levels. So you cannot take that as a hook, line, and sinker. However, if there's a family history, then you can screen that patient for inherited thrombophilia. That is all these things like deficiencies that can predispose to what is called VTEs. Then, okay, I think in answering the hormones involved, I've also talked about predisposing drugs. Okay. In addition to the predisposing drugs, sometimes even drugs used, I've talked about hormonal drugs like hormone replacement therapy and then contraceptive pills. But sometimes even drugs used in the treatment of cancers can predispose to VTE. Cancer itself, if we remember that, it can predispose to VTE. Then even the drug they are using, so it's like a double-edged sword. Thank you for your questions. Then, I wanted to know how emboli is moved. So now, if you remember that picture where it's abnormal, have you seen gutter that is not clean? Water is passing through, then there is a mesh, debris, and all that dirt inside the gutter, right? But as water is flowing, what will happen? One waterproof will detach and move. It may not be all in the same day. Then maybe after another 48 hours or more, another waterproof can detach. Because in as much as that clot has formed, blood is still flowing. What's it called? The inside of the blood vessel has been narrowed a bit because of the clot on one side of the wall, but blood is still flowing through this side. And so far as blood is still going, still flowing, little bits of the envelopes will continue to be detached. You know, the risk of detaching is there. Then, in addition to the risk of detaching, there are certain predisposing things that can lead to why it will detach. For example, if the person has a cancer, that blood vessel has certain markers in it that get upregulated, like P-selectin and things. And this will increase the likelihood of an embolus happening. Also, it could happen based on maybe the predisposing condition. If that person already has a thrombophilia in terms of hypercoagulable states, then the likelihood of an embolism is there. Then, of course, if we look at immobility, if the person is immobile, then that immobility encourages what? Stasis. And with stasis, it is easier for the blood clot to detach. Then the last question was on the diagram. So I said that blood clots can happen anywhere, but the leg veins are the most common veins. So it could happen below the knee, it could also happen above the knee. Okay? If it happens below the knee, the person could have calf pain. Calf is here. This is the calf. What they used to call Sally. This is where it will be. But even when the clot is here, because when the clot is here, what's happening to the blood flow is going to be slow. There's going to be congestion, right? So because of that congestion, swelling will happen here and still affect here. But let us also remember that, like I said, clots could happen anywhere else apart from the legs. I gave the example of placenta, I gave the example of the heart, I gave the example of the brain. Let me also give you an example of the hand. Intravenous drug abusers, people who abuse drugs, they are more likely to have deep vein thrombosis occurring in the hands. So the leg is the commonest place, and that's why when you see DVT, you always see a picture of the leg. But let us also remember that clots can happen any other place. Thank you very much.
Let's put our hands together for Prof. Thank you so much, Prof. And let me just add one thing, Prof. Another thing that can make the clots to break and move is massage.
Yes.
So 2 days ago, Tuesday, I was at work and one of our sickle cell patients came. He had a swollen, painful thigh. D-dimer was 5,000, normal should be less than 500. We sent him for, he had been massaging the leg at home since the pain started. And so that's one thing that can break up the clot. So I just said, stop all massage, just be on anticoagulants. Thank you so much, Prof, and thank you for being a wonderful audience.
Thank you so much for, I believe if you have more questions, you can still reach out. I believe. Our office is here, Grandford. If you don't know the office, I can take you there. Okay. So, and then this lecture is on YouTube. You can go back and play it back. If you did not come to meet the lecture from the beginning, you have the opportunity to speak this thing to her. But before she goes out of this hall, we want to do a little presentation to her. There's something for her to remember that she did something here. So, our father is in the house, the father of the university. and he will do that presentation for us. So I call, can I have the please, can we give her a clap for bringing
hello. Present the award. I must mention how much I enjoyed the lecture. It's good I stayed back. Earlier on I did this was on 20 minutes, and I was thinking of going back to the office. But right now I'm so glad that I stayed back. Thank you very much for such a good delivery. And so, on behalf of the HBTSSN, yes, I thank you for
to be the best. Number one, nothing less.
Somebody who can treat jazz. The one that resembles this one, you can treat it. Thank you so much for the lecture. She's leaving us to go and attend to other things. Otherwise, I wanted to pin her down here, but she's a very big lady here, and she's representing the Vice Chancellor somewhere. So you know that it's beyond what I can do. So thank you so much.
That was a wonderful one. And the message flowing. Hello? When you keep life flowing, you might just be the next person to receive an award like this. Say to yourself, I will receive an award. So let's keep life flowing. Ladies and gentlemen, next to take us on the presentation is no other person than Apple. She will be talking on the pathophysiology and of thromboembolism. If your hands are not too busy, please put them together. As a big record. Doctor. You're welcome.
Good afternoon. Let me use this opportunity to thank our daddy for being here with us. Our daddy, Professor S.D. Abbey. Daddy, we thank you. We continue to love you. Each time we call you, you're always there for us. I will also talk about venous thrombosis, pathophysiology of venous thrombosis, thromboembolism, peritoneal injury, abnormal blood flow, hypercoagulability, risk factors, and then I will conclude. So, has stepped into every aspect. She covered it, if I can use that word. She covered venous thromboembolism. And what we are going to be saying, she has made our own shots for us and made it simpler. So I don't think I need to go into the definitions anymore because I think that she has defined most of the terms there. But for pathophysiology of venous thromboembolism, we're talking about disturbances of normal from it. Next slide. I'm sorry, this one is going to be sounding very academic. I am not a hematologist, but it's good for us to also know. So for venous thromboembolism, it is a disease that may manifest itself either as deep vein thrombosis or pulmonary, maybe proceed to pulmonary embolism. So when we talk about venous thromboembolism, we are talking about DVT, and we are talking about PE, which is the pulmonary embolism. Now, venous thromboembolism is a major health concern that has continued to pose a challenge in our world today. Even the professor that just mentioned it to us, it is now known that it is one of our challenges. We have people know about hypertension, diabetes, and some other diseases that can predispose one to hypercoagulability. But for thromboembolism, a lot of us don't pay attention to it because, of course, it's not in our country, in Nigeria. You know, when she was talking, she was mentioning foreign countries. But here in Nigeria, it has not been made known to us. The alertment is not there for us to know that this is also a challenge, not just hypertension, diabetes, and all that. Thromboembolism is also a challenge, and we should be aware of it. It's also a health concern, and it will be very nice for us to be aware of it so that we know how to either prevent it or manage ourselves when the time comes. Now, it is one of the major causes of morbidity and mortality, which I have just said. Next slide, please. Next slide. Next slide. Okay, we'll go straight to pathophysiology of venous thromboembolism. I don't need to go back to the prevalence or epidemiology because she already told us that. So for thrombus formation and propagation normally, it depends on the presence of three key influences or three key precipitating factors, which could be abnormality of blood flow or venous stasis, and the endothelial damage of the blood vessel wall, hypercoagulability of blood. The key influences altogether are known as virtuous triad. You know, when she was talking, she mentioned virtuous triad. Virtuous is the man who developed this principle in 1856. And so up to today, that virtuous triad is what we are still using to look at how venous thromboembolism or thromboembolism generally, how it goes, the pathophysiology of it. Although there could be other pathophysiologic conditions, but for now, what has been and is still for now is the virtuous triad. And so I'm going to be speaking more on the virtuous triad. Because when we talk about the pathophysiology of venous thromboembolism, we are actually talking about the virtuous triad. Next slide, please. Pathophysiology of venous thromboembolism continues. Now, clot formation can be due to vessel wall destruction, like I said. It can also occur as a result of hypercoagulability. It can also occur as a result of abnormal blood flow. One of the primary events is that it impaired oxidation of the venous endothelium, is that it evoked by impaired venous blood and triggered inflammation. Once the thrombi are formed, the fate of the thrombus it goes like this. Once the thrombus is formed, you ask yourself, like our sister asked, that what really happens? Once the thrombus is formed, what happens is this. It starts moving. intervention, it is now gradually increasing the thrombosis, involving one section of the vein after another in continuity after detachment from the original thrombus organizing site. It goes in the flow of the blood. Most times, how does it happen? It happens at the leg. Remember I told you that when we talk about venous thromboembolism, two key things are involved that make up thromboembolism. I mentioned DVT, I mentioned pulmonary embolism. So once the clot forms, it moves in the direction of the blood. The blood flows in a laminar form. That is, it flows in a particular direction. And so what happens? It is either the blood, the clot itself moves together, or a part of it, a fragment of it, moves in the direction of the blood from the leg where it has formed. And then where is it going to? It goes straight, travels along with the blood, and goes straight to the lungs. And when it gets to the lungs, what happens? It causes pulmonary embolism. And what is that? What it means is that pulmonary is no longer available for oxygen. Next slide. Now, I also want to let us know that want to let us know that this blood clot contains mostly red blood cells, and these red blood cells are held together by the fibrin strand. But in the case of arterial thromboembolism, yes, what happens is that what's involved here is mostly the platelets, and the platelets are held together by the same fibrin strand. In the case of venous thromboembolism, it is the red blood cells that are mostly involved, held together by the fibrin strands. Now, there is a considerable risk of the blood clot or its fragment getting detached and traveling through the heart into the lungs, where it eventually arrives and blocks the pulmonary artery. So the consequence of pulmonary embolism is that the affected area of the lung is not available for oxygenation of blood. This can be traced back to an inappropriately triggered physiological process of blood coagulation. Normally, we have the normal thrombosis, yes, and then we have the pathological thrombosis. All what we are discussing today is the pathological thrombosis. Next slide, please. Now, this is the virtual strand, diagram of virtual strand. You can see the thrombosis in front, then you can see the endothelial injury, you can see the abnormal flow, and then the hypercoagulability. These are the three key factors that are involved when we talk about thrombosis, or when we talk about pathology, pathophysiology of thrombosis. Next slide. Now, we're going to be talking about the endothelial injury. You know, I told you that this lecture won't be like what we just had, because this one is going to be sounding more of academics, because we're talking about pathophysiology. So, for the endothelial injury, what happens? Normally, at the heart chambers and the arteries, there is always a high rate of blood flow and high shear stress, which inhibits clot formation. Therefore, platelet adhesion and activation are required for thrombus formation in the sites. But the wall of the vein normally is lined by the endothelium. It's lined by the membrane. The membrane, of course, is what I told you is endothelium, which has a protective ability for platelet aggregation by repelling the adherence of platelets to the wall of the veins. Any injury cannot, okay, that's protective capacity of the endothelium, now to help the aggregation of platelet. And platelet aggregation on this side of that injury to enhance thrombus formation. Please, next slide. The endothelium performs both pro-thrombotic and anti-thrombotic functions. Any dysfunction on the normal function of the endothelium will lead to a shift in the pattern of gene expression. So what happens? The genes that favor the protein expression becomes upregulated. The genes that favor the antithrombin becomes less regulated. That is, it decreases. That is what happens, leading to decreased expression of thrombomodulin. And thrombomodulin normally is expressed on the surface of the endothelium. So it naturally combines with thrombin and converts it to anticoagulant, followed by activation of protein C. Next slide. But the low expression of thrombomodulin leads to thrombin expressing procoagulant and pro-inflammatory effects. Once there is a low expression of this thrombomodulin, which normally is not supposed to be, what happens is that it now causes the thrombin, which ordinarily should have converted or activated protein C, it now causes it to express procoagulant and pro-inflammatory effects. So there is decreased expression of the protein C and tissue factor pathway inhibitor, all giving rise to decreased anticoagulants. The endothelium itself express increased plasminogen activator inhibitors, giving rise to decreased fibrolysis. And when there is decreased fibrolysis, what happens? It favors thrombosis. Next slide. Another thing that happens here is that the plasminogen activator cell also is increased. Now, the next influence that could predispose us to venous thrombosis is the abnormal blood flow. And how does that one happen? Normally, blood flows. Like I said, blood flows in a smooth and regular pattern. That is in a laminar form. Blood flows. You know, this is, let me say, I read a line and I read another line. And then in the middle, you have the cells. In between, you have a clear section, which is the plasma or the fluid that does not contain this, that is not the cells. But the cells, the cell components are in the middle, just like what she was explaining. So immediately there is an injury. What happens? The platelet comes in contact with the wall, and once it comes in contact with the wall, what happens? There will no longer be a smooth flow. Even if there were any other thing that happens, there will no longer be a smooth flow. So blood flows in a normal and regular, in a smooth and regular pattern, and then so a slow flow of blood in the venous blood stream is associated with platelet aggregation, just like what I explained. Now, abnormal blood flow involves turbulence and stasis. But turbulence most of the time occurs in the artery and in the heart, while stasis most of the time occurs in the vein. When blood flow becomes turbulent or there is stasis, the following contributes to thrombus formation. What are those following? One, the platelet comes in contact with the endothelium that I explained to you. endothelium gets activated and becomes dysfunctional. So there is increased adhesion molecules and procoagulant activities. And what next that happens is that it prevents the washout or dilution of activated clotting factors and also inflow of clotting factors is inhibited. Next slide. Examples of how this led to thrombus formation include. Now, there could be ulcerated atherosclerotic blood. When the atherosclerotic blood becomes ulcerated due to turbulence, it exposes the subendothelium, and then the subendothelium original factor and tissue factor, and what happens? It favors thrombosis. The next is aortic or arterial dilation, whereby a balloon-like bulge. This balloon-like bulge is also called aneurysm. It forms in aorta, which leads to stasis of blood and giving rise to the formation of thrombosis at the site of that bulge. It happens at the heart chamber. Now, the next one is the myocardial infection and several others, like she mentioned them here. Please, next slide. Next slide. We have talked about how endothelial injury affects thrombosis. We have talked about how abdominal blood flow affects thrombosis. The next is hypercoagulability. Normally when we talk about hypercoagulability, what comes to our mind is thickness of blood, isn't it? I told you that this word sounds academic because we're talking about pathophysiology. So when we talk about hypercoagulability, we are talking about thickness of blood, isn't it? Yeah. Okay. So for hypercoagulability, please go back to the other slide. We have the primary and the secondary. The primary is genetic, while the secondary is acquired. Now, for the primary, the common causes of primary hypercoagulability are the factor V gene mutation. When there is a mutation in the factor V gene, when there is a mutation in prothrombin, increased level of factor 8, factor 9, factor 10, mutation in fibrinogen gene, and non-blood type O. Non-blood type O. So that means that those who are not blood group O are also predisposed. Now, rare causes include antithrombin 3 deficiency, protein C deficiency, and protein S deficiency. Remember, she mentioned it here. Now, very rare causes would include fibrinolysis defect, homozygous homocystinemia inheritance. Next slide. The secondary, the risk factors for the secondary include prolonged bed rest, immobility, myocardial infection, tissue injury, which could be as a result of surgery, fracture, or bruises, cancer, DIC, heparin-induced thrombocytopenia, antiphospholipid antibody dysfunction. Other risk factors include cardiopathy, nephrotic syndrome, sickle cell anemia, smoking, obesity, pregnancy, and anything that could lead to increased hypercoagulation. Next. The other risk factors. There are so many risk factors. It's not just the ones we mentioned. So many risk factors. And some of them are risk ones again. Remember, she mentioned about somebody who has had DVD, and still had it again reoccurring. It means that DVT, that somebody has had DVT before, could still predispose you to another season of thromboembolism. So it is a risk factor that somebody has a history of DVT. So there is also significant increase with increasing age. Once there is increasing age, the person is prone to have DVT. So what that means is that once you have crossed 40 years, you should know that it is possible for you to have DVT. Why? Because most times, when we have reached 40 years, okay, imagine since we came here with this, our daddy has been sitting down here. For somebody of this age who has been sitting down here and he does it consistently, what are we expecting? No, Daddy, I'm not saying you should go home, but I'm just telling us. So, like, it is important that we have to always stretch ourselves. We stretch ourselves. Once you're up to 40, you should increase your activity level. In fact, the era of sedentary time has passed. You don't go sitting down at a place for 4 hours, 3 hours, 5 hours in the name of your doing academic work or in the name of your selling in the market. I know some of us have shops. We finish academic work here. We have started in our office for 3 hours, 4 hours doing academic work. When we go home, we are running straight to our business. We get there, we sit down again for another how many hours because we have people that are selling for us or people that are doing one thing or the other for us. So we are sitting down again. So once you have increasing age is a predisposing factor. That means that once you have reached that 40 years, you should be careful how you live your life. Now, patients undergoing surgery, which I have mentioned before, major medical illnesses, I've mentioned that ischemic stroke, congestive heart, cardiac heart failure, acute respiratory failure, use of oral contraceptives, which she mentioned here for us. I told you she made her journey short. So use of oral contraceptive pills, hormone replacement therapy, acquired hypocoagulability state, such as lupus, anticoagulant, and antiphospholipid antibodies. Inherited hypercoagulable state, we talk about activated protein C resistance, factor 5 mutation, like I mentioned before, protein C deficiency, protein S deficiency, antitrophin deficiency, protein G mutation. Next slide. So, in conclusion, what are we saying? That given the high prevalence of VTE, its clinical silent nature, and the potential for rapid mortality, prevention is the key to addressing this disease. If appropriate and effective prophylaxis is given, a good number of lives can be saved each year. Therefore, screening every patient for risk factors prior to or at the time of hospitalization to ensure that appropriate prophylaxis is provided for hospitalization for hospitalized patients is critical. Maintenance of healthy lifestyle will go a long way. In fact, that is the one that I am really concerned about. Maintenance of healthy lifestyle. It will go a long way in preventing the disease, especially the acquired form. If you remember, we mentioned that there is acquired and there is the genetic. So if we maintain a good lifestyle, it can help us. It will go a long way in preventing, especially the acquired form. Next slide. Next slide. Next slide. That's okay. Very much.
Ladies and gentlemen, that was another wonderful presentation by our own Dr. Stella. Please once you can put the presentation on. I sincerely want to tell us that I am a very, very good biblical student. In fact, when I was much younger, now a bit old, I attend Sunday school very, very well. Thank you, sir. So I got things behind me. Now I said, a little, and they said, practice. Bible said, practice what you preach. We are here to keep life going. And we've been sitting down for quite a number of hours now. So please, I crave your indulgence. Let's stand up, do some of those things we were taught, and then we can continue again. Please, nobody should disobey us. The Bible says, for the spirit of disobedience is like what? I told you I'm a very good biblical student. Yes. Okay. That's a great job. Thank you very much. Thank you very much. At this point in time, you can put your hands together for yourself. Okay, for the just concluded lecture, we will take 2 questions because of our time. 2 questions. Okay, I have one here. Okay, and I have one this week. Properly and well distributed across board. So, question 1.
Thank you very much, our doctor, for that wonderful one. I just want to ask one question. During the time when you were giving the lecture, you mentioned something called blood turbulence. Blood turbulence. What will you say? What is blood turbulence?
Good afternoon, everyone. Thank you very much, my lecturer, for that wonderful lesson. I want to ask, in your conclusion, you said there should be appropriate and effective prophylaxis should be given to save life. And someone told me that taking aspirin after the age of 40 will help. I want to know that is true, if it's correct or not.
Yes. Thank you. Let me start by answering the first question. So, you asked the question of blood turbulence. Normally, if the blood is not flowing in the right direction, the blood has a direction that it flows. And so, if there is, for instance, atherosclerotic plaque, and I explained that if you let me rule a line this way, and then in the middle are the cells, that the components of the blood, they don't have contact with the cell wall, with the endothelium. And so anything that causes the endothelium to have contact with the cells, it causes a turbulence. Yes. Now, for the prophylaxis, I know that somebody is here to tell us about management, so he will speak on that.
Ladies and gentlemen, it's getting better and better by the minutes and hours of today. Don't forget the theme of today's program is Keep Life Flowing. The next to take us is no other person than a man I'm not convinced I've met before, but setting my eyes on him, I must tell you, I fell in love. If your hands are not too busy, let's put our hands together as we encourage Dr. Uche Okite, consultant hematologist, University of Port Harcourt Teaching Hospital, to take us through the hospital-associated thrombosis and management of thrombotic patients. You're welcome, sir. You're welcome.
Good afternoon, everyone. The chairman of New Zealand, the president of the association, the distinguished speakers that have spoken before me, professors here present, distinguished guests. Thank you for having me, sir. You are first of all for their statement. Thank you for having me here to present this topic. It's indeed an honor that has been given to me. The previous speakers, they've actually taken most of the things I wanted to say. They've already said most of the things here. I was there sitting down, I was telling myself, waiting remain. But as we are here now, I don't hope I must stop now, no issue. Okay, no problem. So I'm going to be talking on hospital-associated thrombosis and the management of patients. Next slide. Now, the thing now is we have conveniently, you know, it was called hospital-associated thrombosis. We are calling it hospital-associated thrombosis. Before, it was being mostly called hospital-acquired thrombosis. We've conveniently changed the name, you know, from hospital-associated, that it was just a hospital-acquired. You come, we give them to you. So it has changed gradually, but both the names, you will be seeing them interchangeably. Most of the time, it's used interchangeably. Next slide. Now, I'm just going to talk on this with this outline. And the other one is just showing everything that has been talked about today, which is showing the deep vein thrombosis, then how it travels and goes up to the lungs. They've all talked about most of these things, but we will talk. So, first of all, you know, we've come today and we have demonized clotting somehow, isn't it? But clotting is not bad. Let me start from there. Clotting is not bad. Your blood's ability to clot keeps you alive. It is when it happens abnormally, like they have said, that's when it's now a problem. You know that without clotting, just from shaving, you could just go like that. I don't want to mention that, but you could just go like that. Then even that precious bone you like chewing, that will go into your, and you say, the thing don't hook me. It could cause bleeding even within your digestive system, and that means you're bleeding. So clotting on its own is not bad, but when it's abnormal, like now becomes a problem. This next slide. Now they have talked about most of the things here. They talked about the definitions. Next slide. They talked about definitions, what an embolus is. An embolus is not just blood that clots and will form an embolus. There are other things that could cause an embolus to form. That an embolus is just a blood clot, air bubble, infected tissue, even cancer cells, that are other objects that have been carried in the bloodstream. That's what an embolus is. So, but here we are now talking about one that is caused by a thrombus, which is from the blood. Now, embolism is the obstruction of the flow of blood by an embolus. An embolus can be anything. Then thrombosis, we've talked about of all that, so I will still continue. Next slide, please. I think Prof also showed this picture. This is just what an embolus looks like. Now, just to so that you will have an idea of what we are saying, let it be graphical. Now, you know that blood, red blood cells, as an example, a red blood cell is just one tiny cell, and it is said to be bipunctate in shape, right? And why it is one of the reasons why God made it so, we are guessing right now, is that it can flow through the blood vessel. And when it gets to the tiny blood vessel, it can change, it has that amoeboid movement. It will change its shape and just fit into those small vessels and pass, right? Now imagine that this now happens. Can you count how many blood vessels, blood cells that are red blood cells that are there? There are so many, and they are now immersed in something that is bringing it together. Now imagine this: when one red blood cell will find it difficult sometimes to pass through certain capillaries, certain smaller blood vessels, then imagine when there is now a group like this forming, what will now happen to the vessels? I'm not talking of the big ones, even the small ones. Then you will now understand better later why this is a very important issue. Now, they've almost talked of everything. The venous thromboembolism. Venous thromboembolism is a condition in which the blood clot blocks the flow of blood through the veins and venous. Next slide, please. Okay. Through the veins, and it can be divided into deep vein thrombosis, pulmonary embolism. We've all talked about that. I'm going to try to be fast so that I can be done on time. Now, the problem, next slide. Now, the problem is this deep vein thrombosis. I'm still coming to the hospital-associated deep vein thrombosis. So, DVT is the presence of a thrombus in one of the veins. Deep veins that return blood to the heart. It commonly involves the deep veins of the leg or arm, as Prof talked about it. Now, if we are talking about leg, yes, they were right in saying, or she was right in saying that it mainly affects one leg. It's one leg that could happen, and then you have a deep suspicion. However, I just want to put a small tweak to what she said. Now, most times the deep vein thrombosis happens in one leg. It's just so that if you go out there, you know what to tell them. Now, it could also happen in two of the legs in certain conditions, like people that have cancers. You know, this cancer, one of the reasons why cancers can lead to this is that cancers, you know, when they spread, the cancer cells sometimes they carry, they have tissue factor that they release. And then when this tissue factor, when she was talking about the physiology, how the whole thing happens, if it goes to the other leg, it would sit there and also cause, and it sits the other side, to both sides. It would cause VT or DVT in both legs. Also, this DVT can also happen, it can happen not just in the calf and the thighs, it could also happen at the pelvic area. Now, when it happens at the pelvic area, that's at the, we call it the bifurcation, where the big vein, I'm just going, because we have a diverse audience, I'm going to try to be as commonplace as possible. When it happens at the vein where there is a bifurcation, where it now goes, one goes to this leg and one goes to the other leg. When the thrombus now goes there to form, which is rare, but it can happen. When it goes there to form, it could still lead to the swelling on both legs. So the person could now have deep vein thrombosis on both legs. So there is happening that one has the pains and swellings on both legs. Don't say that it is not just those, it's only one leg is meant to happen. It doesn't happen in two legs. It is rare, and that rare can be that one person that you know. So we should always be careful when we are dealing with that. So it commonly involves the deep veins of the leg or arm. It can happen in the arm, often leading to valvular dysfunction, chronic leg swelling and pain. Now, I followed this pattern of valvular dysfunction, chronic leg swelling and pain, so that we will get to something later. Then, however, if left untreated, it can now go ahead to cause pulmonary embolism. Prof brought this particular diagram. The next slide, please. No, before, the one before this, please. This particular diagram was there before. Now, but I want to, you know, I talked about, I want us to understand why we are having this problem. Now, this valvular dysfunction, you know, this is the normal red blood cells, how it flows. And at the top there, you can see that there is something that is like a valve there, right? Yeah. You can see the thing that is feeding both sides. Yeah. Now, when blood is flowing, God has so made it that area, when the blood, you know, when your heart pumps or when you walk, the blood goes up, then that valve will close. And then when the blood pumps again, it opens up and closes, so that there will not be a backflow. That is one of the reasons why the leg, when the thing is happening at the leg, it could lead to a problem, but I'm coming to it. So when this thing is now, you can see that thrombus at the second diagram, that gathering blood clot that is at that valve. It could grow to the extent that you can imagine where it is impinging at the foot of that valve it is going. It could lead to valvular dysfunction. So when it is now pressing on that valve and the valve cannot close and open normally, what do you think will happen? Blood will start flowing backwards. So there could be a backflow. That's now why when the thing is pumping, it's not meant, God has made it that it shouldn't be remaining open. But something is now there to cause it to remain open. What will happen? Backflow. And with the backflow, there is increased likelihood of the person having fluid leaking into the tissue. And with the leaking into the tissues will start swelling up. With the swelling up, there will come the pain that will happen. So, because I'm gradually going into the clinical pictures that we are going to see. So, pulmonary embolism, we've said so many things about it. I don't really think there's any me talking much about it again, but it's said to occur when the blood clot is lodged in one of the pulmonary arteries in the lungs, restricting blood flow to the lungs. Most of the other things have been said, but let me now go straight to this diagram. Next slide. Let me go straight to this diagram. Of course, we've come to the place where the blood clot has formed and it has now moved to the lungs. It's for you to understand what is going on. Let me now push it to this. Next slide, please. Okay. Now, the blood has got the blood clot. You know blood. The embolus is the one coming from down, from the leg veins or from the arm or from any other place. Now, it has now gotten to the heart. The heart now pumps into the lungs. What's the reason of blood going to the lungs? So there will be gaseous exchange. It will collect oxygen that you have breathed in, and then the oxygen will now take, the red blood cell will take the oxygen and go around. But not just that, you should also remember that even the lungs, even though it is the way it is, the lungs also needs blood to survive, isn't it? Because it needs blood, it needs to have blood to also be alive to perform its function. Now imagine what is happening here. I don't know if it is too clear for you there, but look at, you can see where that embolus has gone to stay. There are some arrows. Embolus has gone to stay there, and then that other down place is dark, right? So you can imagine what will now happen to that area. The person, the blood is no more getting there. The lungs is no more being oxygenated. If the lungs is not getting the blood it needs to survive, what do you think will happen? Even you will complain. Let me give you an example. You that be sitting down, after some time of sitting, you could start having what we call paresthesia. That your legs will start paining. You will sit or you will stand up to shake off and allow blood to go and supply, and then you will feel fine again and you sit down. Sometimes if you refuse to stand up, sometimes you will start having pains. Then imagine when you cannot shake it off in the lungs. The lungs also behaves like your legs. So when it is getting there, and then blood is not being supplied to your lungs, what will happen? It will complain. You will have that pain. It will tell you, see, I am here. Release me. So not just that. You're not getting, that means what is happening is that that area of the lung is not also getting oxygen to go and supply every other place in the body. That means you're not even getting enough oxygen that will help other tissues in your body. Your guess is as good as mine, but let me continue. So, I now get into hospital-associated thrombosis proper. Next slide. Next slide. Next slide. Okay, hospital-associated thrombosis. It is defined as DTE, that's DVT, or pulmonary embolism, or PE, occurring during or within 90 days of hospitalization. Now, before I continue, there was something I was going to say before I started this. I wanted to do it. I looked at the audience, as at that time our father was here, Prof. Stabi. I said, no, let me not prank these people, because it was going to be a prank. What was the prank going to be? I was going to tell you people that I've already exposed myself, so it's no longer a prank. Okay. So I was going to tell you people that an air crash just happened at Port Harcourt International Airport. If I had said that, what would you think you would have been? And I would have told you, stand up, let us have a 1 minute silence for the souls of the dead. What would have happened here? Silence. It wouldn't have been silence. People will be agitated. Some of you will start browsing. You will start checking Facebook, the younger ones, Instagram, isn't it? And you will now start remembering that your brother that was going to have landed, right? Who is? Did you travel again? The 1 minute silence, it will not hold. But then, now, check it again. Can you imagine that the number of, when last did you hear of a plane crash in Nigeria? It's been a while, isn't it? It's been a while. But yearly, much more people die every year in Nigeria because of hospital-associated thrombosis. And we are more careful, we are more agitated about what is going on, about air crash that will not happen by God's grace, it won't happen. But we'll be more agitated about that. But then, we are now talking about hospital-associated thrombosis today. Now, we are now going to now I go to the next line there. The relative risk of VTE increases, that's VTE is venous thromboembolism, increases more than 100-fold after hospital admissions for surgical procedures. Whereas in hospitalized medical patients, overall relative risk of developing VTE ranges from 8 to 11-fold. Of course, it's not a surprise. I'm sure if I ask some of you, you would have had surgery in the past. 1 or 2 people, at least. You know, in Nigeria, we are so religious that we want to say that we even went for surgery. Check-ups, of surgery. So you can imagine what will happen for surgeries. There is a 100-fold risk, increased risk. And the reason is not perfect. You know that during surgery, the person will be cut open, right? Yeah. The person will be cut open, and then they will remember what Doc told us about how when the endothelium is exposed, then there will be release of some certain proteins that will lead to thrombus formation. And then, so you can imagine when many vessels are now cut open. So there is now increased risk of clots forming gradually, small. Normally in normal clots, what happens is that there will be healing. But what if that person, just what if that person is having the thrombophilias, the hereditary things like protein C deficiency that Madam talked about, that Prof talked about, that could lead to problems, and it wasn't diagnosed. But that person would have been cut open and many areas open for clotting. Do you understand? Now think of what could also happen what if that person had uncontrolled diabetes? What if that person had uncontrolled hypertension? So these are things that will now lead to the person having problems. So you can now understand why hospital-associated thrombosis is a very big problem. But then for medical cases, we've said so many things about how they could lead to thrombosis. But let's continue. Next slide. This is sensational. It's a sensational headline. I'm still coming to hospital-associated thrombosis. I know it is when it is written as papers, as research work. Many people won't want to read it. Those academic people don't go. But when it comes to as news, it becomes sensational. Can you imagine this? This is Metro. Metro is a very popular paper in the UK. 8 hours at work can give you DVT. It's is scary because many of us, we go to work and we spend how many hours? Next slide, please. I'm just going to run through them. Women's deaths linked to TBT on US flights. This is also from the Telegram. Next slide. It's not too clear, but those seats are airplane seats. Could these seats be the death of you? Sensational. Maybe that's when we will now sit up and know that this thing is not a joke. Next slide, please. Yes, this is Emma Christoph's. This is, we've been saying 40-year-old, and I've seen so many young people here. This lady died from pulmonary embolism because she flew from Australia to the UK. 20-hour flight. She came down, had a pulmonary embolism, and died. Next slide. First class passenger victim of the first class passenger. Sorry, let me just continue. Go ahead. So first class, this one please. First class passenger victim of thrombosis. Advertising chief resigns following brush with death after long transatlantic flight. That's okay. You will say it is because it's economy seats. Let me go and buy first class. No first class. They can lie down. They can stretch out. So let me spend more money and not get DVT. This man immediately he had thrombosis from because he's an advertising chief. He travels up and down. Immediately he had the thrombosis. The guy resigned. He doesn't want wahala. So that now brings me to this. Okay, before I get to the next one. Now this is a lovely. Next slide, please. This is a lovely cartoon. He said, "What a miraculous escape from deep vein thrombosis." Can you see this cartoon very well? A plane crashed. So they jumped out and entered the raft from the plane. So he said, because he's no more flying, that he has escaped deep vein thrombosis. When I saw this cartoon, I laughed. Why I just put it here is for me to remember. So that the next time my kids come and tell me, "Daddy, let's go for a vacation," I'll tell them, "I love you so much, I don't want you to have deep vein thrombosis." Next slide, please. So, okay, it's also about deep vein thrombosis. Those of them in London during the World War II, they had problems. They changed to beds and they didn't reduce. Next slide, please. Now, I'm using this thing. I'm still coming to all class later. I'm using this thing to get somewhere. Now, there is car travel related thrombosis. How many of us have heard of people that have traveled for far distances? Maybe they came from Lagos, they came to visit people in their village, and then after the long travel, the person just said, my heart, and died. I've heard of such stories. They will now say it is that the person came to the village and then the village people now killed the person. There is car travel related thrombosis. Car travel related thrombosis have been found. People that travel for more than 4 hours, this is from CDC even, more than 4 hours are also at risk of having deep vein thrombosis. So now, if from flying, the person is held and the person is flying, the person is held, the person can afford first class, the person is held, the person can do so many other things. Even the lady that died, I can tell you that there is no way she would have stayed 20 hours without going to use the restroom, right? For 20 hours, or even standing to shake off from paresthesia. That could have happened. Now imagine you being ill and not being able to move, and you are now kept at a position. What do you think could happen? These people are sitting down to fly. Now in the hospital, they've had surgery, they can't move. And then they are now having this problem. They have the risk factors. What do you think will happen about thrombosis in these people? So I will now go to the epidemiology. Next slide. So it has been said here, heart, I will be using heart from now on. It's not the cap we wear, but hospital-associated thrombosis. Now, heart is the most preventable cause of death in hospitalized patients. That's VTE secondary to, that is due to the person being admitted. Now, they have said many of the things here, so I'm not going to repeat them, but it is being said that Africans and Asians are said to have a lower incidence of having this VTE than Caucasians. One of the reasons is that there is paucity of data, because we have not been doing research to really know how many people will have the VTE in our environment. But a retrospective study that was done in, Ibadan. Ibadan is here in Nigeria, and it was found that there is a prevalence that out of all the deaths, 2.9% of the deaths, you know, it is not here. Here we have this religious thing about doing autopsies, and many of us have not really started implementing them. But it was found out of all the deaths, the autopsies that were done, that those people that died, they are trying to find out the cause of death. 2.9% of the cause of death was from VTE. That means 3% of the people had VTE. Some of us might say 3% is small now, is it 3 out of 100? My brother, what it means is that 3, let's just put it, in 100 days, yeah? What could happen? So, anybody could be one of those 3. Just imagine that we are here, I don't know how many we are, and what it means is that if we are out of 100 here, 3 people can just drop dead here. No, I'm not saying here, I'm just saying amongst the... So, you see the religiosity. Some people are based in practice center. No, baby, it is my neighbor. They are now transferring. But let's just say that 100 people here, okay, 100 of these flowers died. And 3 people out of it, is because of the death was VTE. You can imagine what it means if we are here like this and 3 people drop dead. If one person drops 1, 2, before you know it, even me, I will be here before you. That's the truth, because you don't know what the cost is. So, if it is hospital associated and this is the level, then there is a problem. Now, 65% of those people, I'm talking of the study in Ibadan, 65% of those people were above 40 years. I don't know why I crossed this 40. So, it's a but it was said that it has said national, everybody is saying, oh, females are more affected than males. But that study showed that males in Nigeria were more affected than females. So no one is safe. So that same publication was talking about malignancy was the commonest cause. But then look at that. Immobility for more than 4 days was the cause in 27.6% of people. That means almost 30% of the people that died in the hospital was due to VTE. That on its own is scary. So major surgeries, 13.8%, and so many things like that. Let me just rush. So VTE, okay, in the United States, they have said so many things about it, but the last line there, okay, please, next slide. Sorry. Go ahead, next slide. Okay, the last line there says as many as 70% of cases of hospital-associated VTE are preventable through prevention measures, such as thromboprophylaxis and use of compression stockings. Just imagine that 70% are preventable. If 70% of the deaths are preventable, so why shouldn't we say things that will help us prevent it from happening? So that is really why we are here. Next slide, please. Next slide. So, it's not too clear, but this is just to show about surgeries. It was shown that those that had surgeries for 1 to 2 hours had 20% incidence of DVT. Surgeries that lasted 2 to 3 hours, this is a research in the US. Surgeries that lasted 2 to 3 hours, they had incidence of DVT of 46.7%. That's almost 50%. And those that had surgeries that lasted for more than 3 hours had a 62.5% of them having DVT. So imagine how many surgeries that go on in the hospitals today. and them having DVT. This is the US where we say, oh, they have better health care. And 62% of people were developing DVT while being in the hospital. So that shows you what the problem we are talking about here. You can imagine 62% from surgeries. Now, next slide, please. So we now have the risk factors. They've talked about many of them: moderate risk, high risk, very high risk. I don't want to go into many of them, but let me leave them. But let us also know that the last speaker talked about inflammatory conditions being a risk factor. Now, those inflammatory conditions, even somebody that has arthritis, let's pause. We know somebody that has arthritis, right? No matter what, we know somebody that complains of pains in the joints or something. Arthritis is also an inflammatory condition. And people that have arthritis even have threefold risk of developing DVT than the normal population. That is something to think about. So let's continue. So next slide, please. So this is just talking about the hereditary thrombophilias that we talked about. Let's continue. Next slide. So other risk factors are there. We've all talked about the risk factors, including the drugs, phenothiazines, and the rest. Next slide. So we've talked about the pathogenesis, the Bechdel triad. There is no need dwelling on it. The time is almost gone already. Next slide. Next slide. This is still about the endothelial injuries causing the problems. Next slide. Next slide. Next slide. Let me leave all these and move on. Next slide, 2. So clinical features. Now we've talked about many of them. So how do you know that you had DVT? I'm starting with DVT. So one of them is having a high index of suspicion. Of course, if you know, you will be able to see. So that it is not when you are having the pain, you will say, oh, let me just enjoy it. It is just small pain. So when you're having it, please inform the doctor. The doctor will also be able to tell will now be able to elicit to find out whether the person has DVT or the pulmonary embolism. So we now talk about history and physical findings. Some of them lead edema, that the legs will be swollen, ischemic form. Some of them you will see one of the legs will now start turning gangrenous. It will just start like the Igbo people will call it achebe, where their legs will now start decaying, and they will say, oh, he matched something. Not be matching something. So tenderness, if you touch the leg will be painful. Then we talk of warmth. The warmth, how you will know that the leg is warm is that you will feel the warmth in the leg and not the one that is seemingly normal. You'll find out that one of the legs is actually warmer than the other. Then you will know that it is likely the person has DVT. Erythema, the red leg will start turning reddish. Palpable cord. Around that area, you see some people, they will tell you that there is a line here that it is painting them. It is just along the line. Along the line, it's that cord. It is likely the person will have a DVT because it is along that line of the vein that will now the person will now start feeling pain, and it's also a risk. So the person should be further examined. There is what we call human sign, where we do dorsiflexion of the leg. That's the leg is staying like this, and then you bend it that way, the person will feel some pain. So even on your own, if you are having all that, if you do that bending of the legs, the person will feel one sharp, sudden pain. There is what we call the Pratt sign. I'll leave all that. Let me, my time is gone already, but let me just be fast. So we've talked about these ones. Then the cow circumference. You'll find out that one of the legs is bigger than the other. If you're feeling that pain, one of the things you could also do is you just on your own, just take your take a measuring tape and measure between the lateral malleolus, that's these protuberance here, to the middle of the leg. Measure around it, check it. You measure the other one, check, and see if there is a difference in the size. Normally, the one that is bigger is likely where that problem is coming from. If more than 2 cm, then it could be the person having a DVT. my organ. I know you're walking around and telling me my time as well. So DBT, guys, next slide, please. Next slide. Okay. There are things we check when we want to say, check if somebody has DBT. I'm not going to get into it, but these are things that doctors will always check to know if the person has an increased likelihood of having DBT. The person could have an active cancer. Is the person paralyzed? Is the person immobile on the bed? Is the person not moving the entire leg? Is there swelling on the leg? Is he happening in two sides? Is there pitting edema in one leg? That if you press the leg will go in. All those things are usually checked. Then there is the scoring for it. I will not go into that. Then clinical features of PE, that's pulmonary embolism. When the clot has now left and gone to the chest, how will you know that it has happened? The person will be dyspnea is that the person will be breathing very fast. Then pleuritic chest pain. Now the pain for pulmonary embolism is said to be pleuritic, in the sense that if the person breathes in, you know sometimes you go and the doctor will tell you breathe in, out, in, out. One of the reasons is to check, there are so many things to check from that. By that breathing in, when the person inspires, the person will feel pain in the chest. So the pain comes more from when the person breathes in deeply. That's what we have. Then cough, the person will be coughing, hemoptysis, that the person will be coughing out blood. So other features of PE, that's pulmonary embolism, the person could have seizures, the person could faint, have abdominal pain, fever, productive cough, diaphoresis, that's the person is sweating excessively, cardiac murmur, those are things we check in the hospital too. Okay, so diagnosis, there are so many things to do. We could do that's for DBT, we check, we talked about them. The Doppler ultrasound, contrast radiography, which is the main thing to do. Then the D-dimer assay in the laboratory. For pulmonary embolism, we check the D-dimer, check the arterial blood gases, serum troponin, brain and natriuretic peptide, done by chemical pathology department. So other radiographic and diagnoses are all there that we could do. We do the pulmonary angiography, CT, and that's computed tomography and angiography, and the rest. To just see if we will be able to see those clots in the chest. Next slide, please. So, diagnostic algorithm. These are things we usually check. We usually compare the D-dimer levels and then check with the ultrasound of the legs. Whenever we see things that are different, there are things we will see and now say, okay, this person definitely has DBT. Next slide, please. So, general advice to prevent hospital-acquired thrombosis. So, number one, do not allow patients to become dehydrated. Now, one of the things is that the person is in the hospital and they'll say, oh, I don't want to drink water. Let me just take, it is the water that will still get into your plasma and now from that into the blood to form part of the fluid in the blood. So when you have enough fluid that will enter into the plasma to make up that volume, of course it will aid red blood cells and the other cells to flow freely. So when your person is admitted and is in the hospital, please encourage the person to drink water. We always say at least try to take 3 to 4 liters of water a day. It is something that we should do. It helps to discourage DBT. So encourage the patients to mobilize as soon as possible. Yes, the person has done a surgery. Oh, I don't want to stand. Oh, I'm tired. But the thing has started healing a bit. So as soon as possible, get the person to get moving. Proper nursing care. When the person, I know our hospitals, they are not properly, our nursing, we don't have enough nurses. Let me just put it that way. So because it should be one nurse to two patients. How many places do you find that? So that if the person is there, the nurse will help say, okay, move this, move your body. So it will help turn the person from time to time. So proper nursing care will help. Then the question the person asks, do not regard aspirin or any other antiplatelet drug as adequate prophylaxis for VTE. Now that you're taking aspirin, I hope that answers the question. Aspirin or any antiplatelet drug, it is not enough do not regard it as adequate prophylaxis for venous thromboembolism. So then the doctors will have to reassess the patients for risk of bleeding and VTE within 24 hours of admission or whenever the clinical situation changes. Everything should be monitored. So prevention, we have talked about the anti-embolism stockings, there are foot impulse devices that could be kept, and then that helps the patient. Now, you know the compression stockings, you will be asking yourself, why do we wear the compression stockings? That compression stockings, it helps to keep the vessel dilation. The vessels will dilate. So it helps compress so that at least the lumen is big enough for blood to flow. Let me not go into it more. So treatment proper, supportive, definitive. Treatment proper, supportive, definitive. Remember I told you even anemia could be a cause. So you treat, if the person is having anemia, treat the anemia. If the person is having cancer, treat the cancer. If the person is hypertensive, manage the hypertension. If the person is diabetic, the diabetes should be managed. Now for definitive, what do we now do to treat these people? We have the pharmacological and non-pharmacological treatment. Pharmacological treatment, we give anticoagulant drugs. There are so many of them. Next slide. There are so many of them. They are written there. We have the unfractionated heparin, low molecular weight heparin, the direct oral anticoagulants are also part of them. Next slide, please. Then we talked about, Prof talked about the inferior vena cava filter, then the compression stockings. They all help. Next slide, please. For those that have pulmonary embolism, they can be managed by embolectomy and thrombolysis. So many of the drugs could also be given. Next slide. Let me just go to in conclusion. So in conclusion, I'll just say hospital-associated thrombosis occurs in many hospitalized patients and could prove fatal. Identification of the acquired risk factors, prevention of hospital-acquired thrombosis, early diagnosis, and institution of appropriate therapy gives a better outcome for our patients. Next slide. These are my references. Next slide. Thank you very much.
Ladies and gentlemen, that was a very wonderful presentation. Please once again put your hands together for me. This afternoon, on a very lighter note, join me as I recognize and make welcome the presence of the HOD of the Department of Medical Laboratory Science, Rivers State University, Port Harcourt, in the person of Professor E.S. Bartius. Please put your hands together for me. Distinguished guests, ladies and gentlemen, please, Professor E.S. Bartius, please, you can join Prof and other dignitaries we have here on the front row. Please put your hands together for me. It's one man I love so much. I love him, sir. Hello. It is a single privilege and honor to introduce to us and also to make welcome Dr. Mrs. Teresa Jeremiah. I know the majority of us will not know her, but she is the wife of our able president, the president of the Hematology and Blood Transfusion Society of Nigeria. It's not just by the name, but it is also in the character and in our ways. Thank you, man. You're welcome, man. Okay, we'll take just two questions for the first question. If you have this car SKN 892AA, please kindly go and repark. You're blocking the entrance to the venue. Also, if you are the owner of this Infinix QX4 EB738 Port Harcourt, please kindly go and repark. For over an hour, you'll be blocking the entrance so other people can use the car park properly. We have those two questions. Okay, I'll pick one and I'll pick two. Okay, questions. We are capable. Please be very brief.
Thank you very much. Having listened to the three speakers, I think it's right time that I ask this question, because from the knowledge gathered here today, I'm now feeling guilty that maybe I have allowed 2 persons to die before my very eye as a result of this thrombosis. So please, my question is, this Doppler diagnosis, I don't know how expensive it is. So I want to ask, as a medical lab scientist, are there some tests that I can actually perform in the lab to ascertain this diagnosis, apart from this other sonographical diagnosis? Thank you very much.
Good afternoon, everyone. Thank you for that wonderful lecture. In fact, all the lectures today has been so interesting. Yes, I actually wanted to ask this question, the first speaker, but on citing management, I started to wait. Actually, it's, most times this deep vein thrombosis happens as a silent disease. One hardly notices when it's starting. We actually lost a good friend 3 years ago, a lady leaving behind 3 kids. Her case started, she felt it was typhoid and malaria, having pains and some, cramps and weakness. She went to church that very day. Evening, she came back. There was nobody even at home, except her 3 kids. So her case actually happened in the evening time, around 6 p.m. She started feeling this pain. No, she didn't notify us. We didn't know. She didn't tell us. She kept on managing it by herself. It was better that we got to know the details about her case. So she asked one of her daughters to alert her neighbors. So one of them actually came to help her. But on the course of going to the hospital that night, before they got to the hospital, it was almost 12 p.m. So ranging from one hospital to the second to the third, before she actually gave up. So it's quite a very shocking story, because she attended service the previous day. So my question goes, please, what are the best, emergency medical advice that can be given to the neighbors of, thrombotic patients? Why waiting for the doctor to arrive, or why being taken to the hospital? Thank you very much.
Okay, before we take the next question, I just want to inform us that if you're here seated and you've not written your name, you've not done your registration, please kindly quietly do that while we are taking the questions. Thank you.
Okay, let me just add this one. It might sound funny. Wearing of tight shoes. Okay, I'm looking at my dog. Wearing of tight shoes, is that also a predisposing factor to this trouble? Okay.
Thank you, Dr. Uche, for the good and inspiring lecture. Now, all through the lecture, we have been hearing thrombosis of the arm, the leg, the lungs, and all that. I want to ask, does this leg include the foot? Can you have deep vein thrombosis of the foot? And if it is possible, how can you manage it? Thank you.
Over to the resource person.
Thank you very much for the question. I'll start from the doctor. The first question was about other tests to confirm diagnosis, right? That outside. Unfortunately, to make a diagnosis, we need to have the Doppler, the D-dimer first, and then the Doppler ultrasound. I didn't dwell on one of the slides. On one of the slides I put there, it also depends on if the person has some risk factors. Then you now go to check the D-dimer. Check the D-dimer, if it's positive or not. You can now, if it's positive, or is increased, you now go ahead to give it Doppler. So it should actually follow the sequence. But the truth is that in some cases, the Doppler may be negative. The Doppler, you might check and you will not find it in that leg. So that sometimes it's about you will now use your clinical judgment with the D-dimer. The clinical features and the risk factors with the D-dimer to now know whether you need thromboprophylaxis or not. So it depends on this patient dependent, but the ultrasound, the Doppler ultrasound should be done. Yes. And it's available in markets. It's available. I know it's about 12,000 in some places, 15, 16,000, 20,000, depending on the place. But it's available. So please, if the person has that, the person should please do the Doppler for confirmation. So the next one, what are the best emergency medical advice for that before the doctor arrives? Now, the medical advice is actually something that should start prior. As for doing it at that time, what the person really needs is thromboprophylaxis. That's giving drugs that will just help. You won't want to start giving, the next thing people will do is go to start pressing the legs. If you heard what Prof said, if the person is having DVT and you go to start pressing the leg, massaging the leg so that the pain will reduce, the thing could dislodge more and now send to the lungs. So it's just better, the best way for managing DVT is actually prevention. That's why we are preaching prevention. Then after the prevention, we now go into thromboprophylaxis. That's why I know if I ask many of us here, how many of us here have gone for any checkup this year? More than half will say no. That's if you've not been ill and you've gone to do a checkup. How many? I doubt how many people will say that they have. How many people have checked their blood pressure this year? How many people have checked their blood sugars? It's a problem with us in Africa, and we should actually try to. So the best way to prevent this, the best way first of all is prevention. From prevention, then if the person starts having symptoms. If you remember, this person started wasting time. There was a things, and when you're seeking, please seek. I know it is difficult for me to say, but seek the right medical help. Because you said you went from one hospital to the other hospital to the other hospital. Seek the best medical care. And also, it's also good that the patient is knowledgeable. That's why we are preaching this. That's why I thank the association so much for bringing this up. That's why we are preaching this so that it can also be propagated outside. But basically, the person develops it. The person needs to be seen, monitored, and then treated properly. Then, wearing tight shoes. Well, you remember, we said wearing compression stockings would help. So, wearing tight shoes won't predispose you to DVT, especially on each of. Does the leg include the foot in DVT? The truth is that any vein can be affected. This protein, even though the ones of the foot, they are mostly superficial veins. They are not part of those big veins. But any vein can actually have clotting, thrombosis happening in them. It just depends. But usually, it's not usually, the foot is not usually part of the leg when we are talking about it, because the big veins that usually leads to it are mostly these ones. The ones in the calf, the thigh, because they are big veins. The ones in the foot are very small. Varicose veins can dispose somebody to having a DVT. Those that have varicose veins are predisposed to having DVT, but it is not DVT. Because when the varicose veins are blocked, there is a likelihood of also dislodging, even though it is not usually the one that will now send you straight to the heart and all that. But those that have varicose veins are predisposed to having DVT. And when they now develop DVT, it can also lead to pulmonary embolism. Thank you very much.
Ladies and gentlemen, once again, let's prepare together for our presenter. Times like this, my heart values me that I'm a medical laboratory scientist and also great hematologist. Hello, I hope you heard me quite correct. Okay, we'll take product presentation to down the rostrum. Let's make welcome Clina Lancet Laboratories for their product presentation.
Before the product presentation comes up, I want to call the two speakers also to present to them our little topic to recognize them today for their I'm really grateful to have you here today. One thing I discovered this morning, this man that came to give us this lecture came in here before me. Before now, he was the only person in this hall. He was the only person. I came in here and went back to the office. I came in before, went to the office. I think I came into this campus 7:30. So I came here, then went to the office. By the time I came back by 9, I saw him sitting down, the only one in the hall. Please let us improve in time management. So I really appreciate you for that. He left his office, left his duties, and came and waited for us here to give us, and still waited until now to deliver his lecture. Dr. Uche, we appreciate you. We will have more interactions, we'll have more time. By next year, this thrombosis thing will be bigger than this, and UPTH will be highly involved. So I call on my revered agent, my professor of chemical pathology. The more you look, the more you see. I am privileged to have him here, so I would like him to come and present this little token. It's an award of recognition for your invaluable efforts to represent us.
Should present this award of recognition to you as a resource person during the World Thrombosis 2022 celebration with the theme Keep Life Flowing in Port Harcourt, Nigeria, on this 13th day of our Lord, the month of October 2022. Congratulations, sir. We are glad to have you, and we'll be glad to have you more. Thank you, sir.
Please, don't go because we still have at least one more lecture and a few things to do. I would like every one of us to have a good picture at the end of this. That picture is going to travel across. I'm going to showcase that picture to the world that we celebrated today. So just wait till the end of the program so I can get that picture. I call on Dr. Lancet to come out and stand up.
I'm taking it.
You want? Dr. Stella, come forward now. Come
Good day, everybody. Okay. On behalf of Haematology and Blood Transfusion Scientists Society of Nigeria, I'm called upon to give this award of recognition to you, Dr. Stella K. Ezigbo, in recognition of you being a resource person during the World Thrombosis Day 2022 with the team Keep Life Flowing. Thank you for making our day.
Dr. James, let me narrate one experience to you, whether it is related to thrombosis. 2010, I was going to Maiduguri. I was visiting lecturer there. I traveled all the way from Chicago to Rome. That was my first time going to Maiduguri to teach, so I was on the road. I traveled by road to Abuja. And when I was sleeping in the night, I was hearing some strange sounds. I turned my neck, I would be hearing some sounds like crickets. So I was thinking it's hiding somewhere in the corner of the room. I turned, I would hear, I told like that, I said, what is the kind of this? So it took me time to realize that the sound was coming from my neck. So I said, is that how I'm going to die? When I realized that the sound was coming from my body, I now realized, so I just went and bought Bengay, bought paracetamol, took massage my neck, did like this, speed. Then I now checked again. I did this way, turned this way. I was not hearing that much. So can that also lead to thrombosis? I was not, can thrombosis happen in the neck? You know, it was very fearful. I was so scared. I think it was also associated with long distance. You know? So it's a very serious business we're talking about. I had of a friend, a doctor who traveled, came back and developed and died from it. Long flights. So we should not be caught into this. That's why we're having this celebration. It's not a fun, but a public enlightenment program. This year we didn't ask anybody to pay money. That's why it's a free lecture. That's why people did not come. If we had asked people to pay, this one would have been free. But because it's free, so anything that is free, that is how it is. But we thank God for all of you that are here and you are getting this message. Thank you. We'll continue our program.
Can we put together for our president, Professor Jeremiah? We have to take the product presentation from Lancet, Clina, Lancet Laboratory. Are you here with us? Okay, please, you have. Okay, 10 minutes, please.
My name is Chokola Pascal. I represent Clina Lancet Laboratory. So Clina Lancet is an ISO recognized laboratory. Just so that we can go back. So Clina Lancet is an ISO recognized laboratory, ISO 151. very soon it will no longer be seeing Clina Lancet. What will be seeing is Stella Lancet Africa. So we are going to move into a bank and joint venture with Stella Lancet. Next slide. Like I mentioned earlier, Stella Lancet. So when Clina Lancet started just as Clina Lab. We evolved to Clina Lancet. We also evolved into Lancet, Stella Lancet Africa. So the idea is this. Clina Lancet is trying to see that laboratory investigation in Nigeria can move beyond from Nigeria to the international community. So that's the reason we are getting ourselves all these affiliations to make sure that the investigations we do here in Nigeria, we can also get international partnership from other countries. Next slide. So in Africa, we have our various representations in those African countries. I think we have our presence in 13 African countries. You can see them on your screen there. Next slide, please. So at the moment we do more than 4,000 investigations. So here in Nigeria we have 11 sites. We have sites in Lagos State, we have in Abuja, we have in Bado, we have in Warri, we have here in Okaka. So we cover at least an average monthly investigation of 53,000. Then in a month we have at least 18,000 working from patients that are from Lancet. So our mission, very simple, to be the leading force in local medical diagnostics in Africa, while offering the highest standard of pathology and biomedical services to patients and medical communities across the continent. Our vision is to provide Africa with the best medical diagnostic solutions at world-class standard to improve the quality of life of communities that are values. So in Lancet, we respect everybody. We are known for excellence. We are committed in what we do and unity in healthcare. So listed there are some of the investigations we do. I mentioned earlier we do at least 4,000 investigations. So we do Haematology, which is related to what we're hearing this morning about Thrombosis. I know most of the doctors around here, they are always do referral to our place for D-dimer, for PCC, and whatnot. So because in Finland, we know what we do around here because the liability of the dogs is what we do. So we do general hematology, coagulation studies, chemistry, pathology, microbiology, and whatnot, and all other investigations like DNA paternity, histology, forensic pathology, and whatnot. Alright, Clina Lancet advantage. So global expertise and experience. This capacity, we've had series of people coming to our place to do paternity tests because we learned that it's one of the prerequisites. I think the immigration will ask you for your DNA paternity test. So at the moment, we are having lots and lots of them. Our prices are very, very affordable and competitive. So we have lots and lots of them. So if our results are accepted anywhere in the world. And I mentioned it's ISO certified. So global expertise and experience, things of globally recognized and independent laboratories, reports reliability and global policy standards, proven track record, internationally accredited, young dynamic and experienced. Okay, we believe that corporate social responsibility, yes. So this is what we do once in a while. So it has not happened here in Port Harcourt, but I can tell you that in Lagos, where we have our head office in Nigeria, once in a while, there might something we call corporate social responsibility, and that's the way of giving back to society. So once in a while, organize that corporate social responsibility, give back to society. So I appreciate them for all the services, or rather, for all the investigations they do with Clina Lancet. And also to make sure that people take their health issues more seriously. When I leave here today, I'm going to make sure that my managers will take this thrombosis day very, very serious. Because most times, people will have pain on their body. They might just be thinking it's low, not knowing to be attributed to thrombosis. So I'll make a case. Let's see if by next year, when we'll be having the World Thrombosis Day, we could see if we could do this corporate social responsibility on thrombosis here in Port Harcourt. So there will be a known policy. All entities, there's something we call control, policy control. Before any test is done, before any scientist starts operating the machine, we do what we call quality control. If the control is not passed, we don't get to do those investigations. So we wait until the control passes before we do such investigations. So avoid people calls and results, which we are not known. Okay. So looking at the development, yes, once in a while, every quarter we do training for our staff, myself and my other colleagues in the health department, we do training. So we always do that at our head office here. So customer service, we run 247. Our first inquiries, we have client service that are there to give you all the feedback that you need. Our locations here in Nigeria, we have in Lagos, we have in Abuja, we have in Rivers, we have in New York, we have in Delta State. Proposition. This was started most just recently, public-private partnership. So Clina Lancet is now in business, is making it known to the general public that we're into the business of scaling existing laboratory for partnership. We also do equipment upgrade for people right now, depending on the results that they. So so we are just looking for partnership from the general public. So when you come to us, we could make the information known to you much more better. Next. Thank you. Next slide, please. Next slide. So 3 months ago, Clina Lancet won the best lab here in Nigeria from the Nigerian Healthcare Excellence. From the Nigerian Healthcare, they won the best lab here in Nigeria 3 months ago. It goes to show that we Clina Lancet know what to do. Thank you very much.
That was a wonderful presentation from
Clina Lancet. But next year, I want to assure you, you will win again. But if you must win, you must ensure that you discover a test that will make you not to be beating so much again. Hello? Hello? Okay, I have been told to inform us that this program you can watch
Now, this seems to be the area that is particular to me. And you know, I have a way I define diagnosis. And from the revelations I have gotten, the diagnosis is a process of determining and designing the nature of disease and then distinguishing it from other possible conditions. The 3 Ds, that is my definition of it. So, that is what we are. So, what is left for me is to see whether we can find out how we can design, determine, and distinguish, especially that there are various types of thrombotic diseases, and then see what we can talk about the process of observing and checking the progress of checking how people who have been treated for thrombosis, how they manage. It has been exhaustively done by people who do them. So it's a lesser job to me. Next slide. Next slide. No, don't have to go back. Come in the haste. Eyes open to thrombosis. Eyes open to thrombosis. And parents, my word is that the people here are children. So what we're going to be discussing is sounding too big. But I think that the intention of Professor Jeremiah and the ESCO of HBTSSN helping us to organize this day is to open our eyes to what? Thrombosis. Next slide. Now, the important thing about all that I'm saying here is that 1 out of every 4 people worldwide will die from thrombosis. That means that if you count the people from your right to your left, 1 of them may die. Whether it is your portion or it is not. Why is that serious? It shows us that the issue we are discussing here is a very serious matter. You see, Nigerians don't take things serious. We don't take things serious. Now, for the first time, flood is covering houses. Before, it don't used to be like that. I mean, you know why we got there? Now, in 1973, 71, or thereabout, when some people difficulty with flooding, they met the Nigerian government, and the thinking was that if we build a dam, this dam they're talking about, the dam can collect water. And then when the dam is full, we can channel water to the Atlantic Ocean. That was the thinking. Nigeria joined to sign the contract. And in our usual way of high sense, back out. Cameroon and the Chinese company that built that dam managed and completed it. Now, but the bad part of it is that when the dam is free, they will release the water into Nigeria. Now, at the beginning, it was something that brings money because it has left the open agency for relief. So who can struggle to become chairperson and chairman of Nigeria Relief Agency, where you buy blanket, buy indomie, and buy rice? They didn't know that the water was watching. Now they have done that, and the water has known that it is blanket and bed and foam that Nigeria has bought. So this year, the water changed their pattern. Now it is filling the whole house, where you will not be able to buy blanket to use. What does that tell us? That Nigerians don't get serious. Even now, nobody. The matter is not even discussed in the Senate or House of Reps. But we thank God that over 26 states is covered, and more states will be covered. Nobody is talking about it. We are used to saying it is not my portion. Just wait. Just wait. It will soon be. So, the issue here, there's no joke about it. About 100,000 of those people You see, when they talk about 900,000 people, and I say 100 of those people die, which is greater than the total amount of people who die each year to AIDS, cancer, and car crashes. You know, the doctor was talking about it. It's a silent killer because we come from a country where something must kill a man. And if it's a woman that is married, it's the mother-in-law. If it's a man, it will be somebody in the neighbor. So we don't know what the matter is. But eyes open to thrombosis is to encourage us, even as students who are studying MSc, BMLS, and PhD in hematology, to begin to look at how we can engage ourselves to get more information. Because all these statistics are saying, when you come to Nigeria, it is zero. No information. So God allowed you to come here so that you can tell somebody that there is a demonic agent of death in town. That spirit that came into Egypt has come into the world now. It's different from AIDS, it's different from COVID. Next slide. Now, this one has been said. All the speakers talked about it. But because I'm a chemist, we are used to equation. So we can say that dVT plus PE is equals to VTE. Next slide. What is thrombosis? The formation of potentially deadly blood clots in the artery. You can see that diagram there. You can see those arrows. That clot, they have been presented in various ways here. This is the way I want to put my own. That is what we're talking about. Next slide, my brother. Now, this is where, if I didn't say anything, let me say this one. Now, let us go look at the board. We'll do something here now. How many of us have heard about I just want to talk about those slides. But what you will see on the first slide is that you will notice that a lot of people like you have not heard about thromboembolism. Oh yes. Now, 85% of Americans say they know what a blood clot is. That's what we know. Because when we kill animal, we see that the blood do what? Clot. But only 20% they know what BTE is. In this journey, only one person will get there. No. So only 1% of students and lecturers who come here know about BTE. That means that if Satan want to capitalize on that one in this state, it will be a very deadly matter. Next slide. not physical ventilation, pulmonary embolism. 81% of people wouldn't know what a PE felt like if they experienced it. That's what the doctor was saying. You know, you would know that the pains you are having on your calf, it could be related to this or the difficulty you're having. Just like if you know that the pains you are having on your leg could be as a result of thrombosis, you will not ask them to massage it. Am I right? But generally in Nigeria, in Rivers State, because we believe that people can massage leg. So any pain on the leg must be massaged. What have we been told today? Pains on the leg should not be massaged. So when you go, tell granny, tell grandpa, tell uncle, tell auntie, that when there are pains on the leg, the thing should not be what? Massaged. Because sometimes, after massaging, there seems to be a temporary relief, and the thing comes back and becomes a matter. Becomes a matter. So we have learned something now, that if you are having pains, especially on your thigh, on your calf, and some part of your body, that you cannot explain, don't massage. If I have not said anything, I have said something that has qualified me to get the flag. Yes, I have. I'm very sure I have. So next slide. There is something I want to say here that has not been said. So go on. Now, thromboplastic disorders, they've said so much. But what I want to say here is that much of what causes this problem, some are congenital. That means that they are genetic. You get them from your parents. And Prof, let me not say what I want to do, but I know that the story about this came into public in either 1920, when in a Norwegian family, they found out that this is wrong in the family. So, we have some that are inherited, some that are acquired. We acquire them. And the most common inherited forms are like what we call the factor V11, FVL, proto-G, a mutation. The less common type are the deficiencies in the natural anticoagulants in the body, protein C and protein S, and of course antitropin 80. These are all natural anticoagulants. Now, you wonder why when they collect blood and put in the tube, it will do what? It will clot. I mean, when the blood is flowing in the vessel, the blood does not clot. Why? Because there are several anticoagulants in the body. So when their quantity begin to reduce, as a result of mutations on some genes that you are now predisposed. So when you stay, like those people we heard about, they come out from the plane and die. It means that they expose themselves to what we normally call predisposing factors. You start for too long, either you're a smoker, you did several other things happen around you, and that predisposed you to the clot. And depending on where the clot lodged, because if it's in the lung or in the heart, because apart from we just talk about DBD and PE, there are also various other forms. For some of in chemistry, what we call atherosclerotic plaque is a bullous, is an embolus that can block the vessels, the arteries of the heart, and that can cause cardiovascular infarction. So someone don't have a pain in the heart, and the pain just does what? Die. Does that make sense? So if there are various specific. So next slide, therefore. Now we talk about the acquired one. Which are all these. Now, in chemistry, antiphospholipid antibody, hyperhomocysteinemia, and maybe the brother, D-dimer, we have tracked them as cardiovascular risk factors. Whereas we call them hemostatic hemophilic factor. That is how we are able to run hematology on the chemical pathology bench. Next slide. Next slide. Next slide. All right. So now, when you have the propensity to develop this matter, it means that you have a problem called thrombophilia. So, which we have said can be inherited or acquired. Next slide so that I can go. I'm getting very hungry. Now, in laboratory analysis, therefore, if we have, because our duty, we are scientists here, the doctors have gone. So, our duty now is people are dropping dead. And the thinking is that these things could be what? Thrombotic matter. What do we look for? Now, listen, we are saying that what we are looking for will be some that we acquire and will be some that we inherit. Does that make sense? Is that clear? We want to just get something. It's not that what we acquire and the one that we inherit, which somebody is saying, the doctor says something. You notice that your mother is always having pains. They say she has thrombosis. So check, because if in your family people have all these pains, swellings and things like this, and that killed them, did you do any test? It means it's possible if they screen you, they can find out whether you have deficiency of one of these natural anticoagulants. The kits are available, screening tests. They may be expensive, that's why you don't find them on the routine bench. But there are kits with which you can check for antithrombin, protein C, or, of course, factor B, and then, of course, this mutation. We can check all of them. Next slide so that we can go. Now, don't get the matter twisted. Hemophilic matter. Hemophilic bleeding, which you use for Wilbran factor, for Wilbran disease, which you use protropin, you calculate international molecular ratio and ABDT, DT, fibrinogen, and possibly this pattern of tests detect bleeding. Those who have bleeding tendencies. I don't be brought because people will be thinking that I didn't call these words. When somebody has hemophilia, it means that you have a propensity bleeding. You're bleeding now, we do that is that you have excess anticoagulant inside you. So your blood is watering. That's why you use this one. For the one that we're talking about now, that one person in every 4 is dying. Next slide. Next slide. That's the one that we have. Factor B leading. Next slide. Antithrombin deficiency. Next slide. Protein C deficiency. Next slide. Protein S deficiency. Next slide. Of course, protein 2210A mutation. Next slide. Of course, even these ones. Go to the next slide. And measurement of the dimer. These ones will be able to locate whether you have a propensity to have blood clotting in your system. Now, go to the next slide. Now, of course, hyperhemocystemia is one of them. Go to the next slide. And then you can also, the events also affect these factors. Because we are tired, don't keep us here. The next slide. Good. So we can also do other radiological tests, like you can talk about spiral computed tomography, you can have duplex scanning, just to locate the clots. There's a lot of scanning ultrasound thing that you can find. And maybe my last slide. So monitoring has been said here. People who suffer it, they should monitor the levels of this thing, the drugs they are taking, whatever it is. That is the part of the doctor. The next thing you want me to say And I'm saying that robotic disorder require partners of test for correct diagnosis. Nevertheless, as a result of positive force affecting the health institutions, provision of equipment and agents are major obstacles to the involvement of laboratory in diagnosis of robotic diagnosis. However, issues of diagnosis of the choice of tests to be performed and the interpretation of results are also of paramount importance. Prof, I am done.
Ladies and gentlemen, let's put our together for this wonderful, exciting lecture. The same thing I will say to the society when they hand over my balance to me. I will say, Prof, thank you. You have done well. Hello. So take questions and don't forget the presentations we've had today. They will be sent to our emails. It requires you to put down the correct and functional email while you're doing your registration so they can send the materials to your email. And also don't forget that after everything, we'll go outside and take a group photograph to commemorate the World Thrombosis Day. Thank you. Let's take questions. Questions? They enjoyed the lecture. They understood everything. So question from there.
You made mention that thrombosis are acquired. So, like, how are they acquired? Like, are they just are they contagious?
They are not contagious. You see, I didn't want to waste so much time, but you discover that there are things we do that can make us available for it. What we call risk factors, predisposing factors. You know, like you're a girl, so you will have a dream that you marry, and that when you marry, you will have a child. Just that you made that mistake to get married, or you took that choice to get pregnant. Pregnancy will make you acquire the option of you can because of pregnancy. Okay, you can have cancer. There are various situations that even diabetes. There are based on this you have. Well, it is not in you, but because you now have an illness or you now find yourself in a condition, then it will now come. So it's not that it's not proprietary. That is why we say that the most popular, the most common is the one that we normally call we are talking about protein C, protein S, which are the natural anticoagulants. Those are the ones that are very popular. So if your parents are always complaining about pain on the leg, the thigh, they always complain. It is important. The test is best ingredient to check, because if it is found in your mother and they are mostly extinct, so anybody that has an X chromosome may have it. So you check to be sure that it's a, so as you are growing up, you are watching out for it. You are doing things that will not allow you to suffer. The thing we are saying about this thing is that, can we listen now? One of the things that this question has brought up is that let's make up our mind that whatever it is that killed your mother should not kill you.
Hello?
Don't die the way your mother died. If your mother was not killed by accident, your mother was not killed by this, but she was sick, and the sickness was that it is all over bed. She can't walk. Find out so that you too, by the time you go to get her aid, you will not look like her. Praise the Lord. Let us praise.
Ladies and gentlemen, that was the sweet and powerful response from a professor that gives an illustration to enable you to understand the subject matter. Thank you, sir.
I think our professor deserves a more other stronger character. But comfort is passing. I'm sure from the beginning of the first lecture till now, many of you have not understood in the way that we presented in this last lecture. So, and you know where he went to? Eyes open, because he's a professor of eyes. He's a professor of eyes. The more you look, so he's still emphasizing that you should keep your eyes open. But this year's old, they said we should keep life flowing. Can everybody shout, keep life flowing? Keep life flowing. Let nothing stop our life. That is why we are here. Thank you all for the exciting lectures, very interesting, very captivating. We have spent a long time, but we didn't know we have spent that much. All because we were enjoying the lectures. If the lectures were dull, maybe the hall had been empty by now. So we are grateful to our lecturers, we are grateful for the listeners, everybody sitting down and taking part. And for you students, you can pick your project topics here. There are so many things to investigate. So many things to investigate. As this lecture from the beginning of the day, even me, I was just thinking of projects, something to do. And that is why students should not miss this. I want to thank you all, the students who are around, scientists who came from wherever. And this audience is not just limited here. This event is being participated worldwide. People are watching from US, watching from everywhere in this country. So we have even more people watching on the virtual side than the one physically present. I appreciate all of you. Those on YouTube, those on Facebook, and wherever they are watching from. I appreciate all of you, and gradually we'll be coming to an end this evening. But before then, let me allow you to say what I want to say. I'll come back and
Okay, it's very important. From the day one I saw this application for this program, I understood that our council is very much involved in this program. Together, let's welcome and recognize the representative of our registrar. It's no other person than our good friend and our brother, Eminent Romeo Minitivis. So welcome, sir. As you see him, he is a big man. He is the council we have here. You're welcome, sir. You're welcome.
we quickly do one or two things and we'll round up and close. But don't miss our picture and group photograph. I want to call, during the induction ceremony, we were privileged, this society was privileged to have 2 students who graduated with first class. One of them was the overall graduate, and the other one graduated with first class. All hematology. Also. So we made an announcement that this society will give them an award. We also made an announcement of a cash of 50,000 to the overall and 20,000 to the second person who got first class. And then we also promised to give them, to decorate them with our lapel and many others. So we want to fulfill that promise in this meeting, and I think the new students are around. Are you available? Where are they? Where are they now? Okay, only one that is available. Ah, where? Okay. because the two of them are PIAs. Do you know what PIA means?
Beautiful.
How many of you know? No, if you are a female medical laboratory scientist and you know, raise up your hand. You will. What about that? Okay. Beautiful, intelligent, and adorable. All right. I want to call on somebody, not because it's my wife, but in her capacity as the state chairman of the Female Association of Medical Laboratory Scientists of Nigeria. I want to call on her to come and do this presentation to these two worthy students who made us proud. You know, these days the women are taking the lead. To support her, I want Eze, Stella, and every other woman who wants to join to celebrate them to come forward. Okay, this is around, Joko come. Then I want as many women to come and celebrate your fellow woman. So they should come down now. Enjoy. Where is Joy, the director? My director, come now. Joko, I call you, come now. Beatrice, Beatrice, morning, will come. A woman, they will follow. All right. I hand over to the chairperson, the chairman, not the chairperson. Chairman, there is no person for chair. All right. You will coordinate the award. This is Lancet. You coordinate them. And then we have a flag. We have an award. And then we have a check to give them. So you will coordinate the ceremony. Put your hands together as I hand over the microphone to my wonderful wife. In the capacity of the chairperson, the chairman of the FAMLSN. Okay, AF.
All right. Thank you so much, Professor Narayana and the HBTSSN for giving me this opportunity. One privileged opportunity that I would say I appreciate. And for my pretty ladies for making us very, very proud, I want to say a big congratulations to you. I was actually supposed to be in your induction, and I'm sure you would have done me better, but all the same, it is not late. So I have the privileged opportunity in the presence of my powerful ladies with their powerful support. BIA. Beautiful, intelligent, and adorable. BIA. Beautiful, intelligent, and adorable. Beautiful, intelligent, and adorable. BIA. So I want to welcome you into the fold. You are a medical scientist, you are a BIA because you are a lady. I wish I was told before now, I would have come with our lapel to jointly adorn you. But all the same, I want to say congratulations. And whatever we're going to present to you, know that AFMLSN, Association of Female Medical Laboratory Scientists of Nigeria, Nigeria River State Branch welcomes you heartily. So congrats for making us proud. We are really proud of you. And I want to advise that it doesn't stop here. So you keep pushing forward, and that is how we'll keep celebrating you. Congratulations. All right. Wow. You have a whole lot. You have a whole lot. I guess this should be the overall grace. You are the overall first class. This is really good. I wish your parents were here. Didn't you know that something like this was going to happen? Wow. Okay. So, the flag reads Academic Achievement Award in honor of your outstanding performance and dedication. We gladly present Grace Extra Gilbert with this achievement award for graduating with BMLS First Class Hematology and Blood Transfusion Science option and overall best graduating student. I like Transfusion Science. Congratulations. We have also a sum of 50,000 naira too. With the society's lapel. Congratulations. Thank you so much for the opportunity. BIA. let's celebrate them. If you're there, please come and join us. Come and join us. BIA, come.
Thank you. I want to do one more thing, then we go out and take our picture. Close. Before then, we'll hear from our host, the South Regional Coordinator. When I finish, he's going to give us a vote of thanks. I think this is. I know he's going to say something about it, but let me thank the Narayana Health. All the way from India, they sent a representative in Nigeria to be here. They came very early. If I didn't come here today, I stayed at 7:30, they will be here before me. They came in very early and they have stayed till now. They did well to make sure that this program took place. The Clina, Lancet, and every other person. We have some that are not here. If you look at the program, you will see few people who sponsor this program and made it what it is. I really send my appreciation to them. Before we go, let me also tell us that the Deputy Vice Chancellor Academics was to be here. And in the morning, I called him. They had a council meeting. It was not possible for him to leave the meeting to be here. He was trying to see if we can have a little space to be here. So I was still waiting for him. But since I didn't see him, I know it was not possible for him to be here. So I want to tell her it's not intentional. He was, really happy to be invited to be here. I really wanted to be here, but circumstances beyond his control, he could not come. But he was here in spirit. So on behalf of him, I want to invite our HOD to take this message to him. Let me invite my HOD to, is closer to him than me, because in the hierarchy of the university, the HOD is closer to, so he will get this message to our Deputy Vice Chancellor that we are happy. We acknowledge the fact that official duties will not allow him to be here, and we know that he was here with us in spirit. So we are also extending our recognition and our thanks to him for being with us, in this program. So that is the award of recognition to our Deputy Vice Chancellor Academics, in recognition of his interest and his activities, supporting us. And I know another time will be here with us. So can we just give a clap of him? Thank you. Take that message to the division on our behalf. Thank you so much. Okay. What is something? Okay. All right. Can I call? Is it Nathan? Sorry. Nathan. Let's invite his colleague. Put your hands together as he comes up. Some of you may not know him. I say clap for him. Clap for him. He's a very vibrant colleague. I saw him yesterday. He came here. I don't know. A lot of us, we are not always impressed, but this is somebody I just know that he has interest. In fact, yesterday I was, for the first time, I just saw him, being vocal, asking questions. I said, and today I just saw my eyes, I saw him. I said, you are here again. Thank you so much. So I want to give you the privilege to do this presentation on behalf of the society. This one is going to our HOD, our boss. So he's going to do this presentation on behalf, and all of us will jointly support him.
Thank you very much, ladies and gentlemen. It's quite an honor to be here to present this, or in fact, I'm shaking to present this award to somebody I idolize, in terms of his academic prowess. And I want to say, sir, we are privileged to present this award, the Haematology and Blood Transfusion Scientists Society of Nigeria Award of Recognition presented to Professor Ebirin Agana S. Patinios as a resource person during the World Thrombosis Day 2022 celebration with the theme Keep Life Flowing in Port Harcourt, Nigeria on this 13th day of October 2022. Congratulations, sir.
Thank you. Actually, that is the only way, the little way we can appreciate all the time. If you have never been an HOD before, you will not know that these people don't have time. The university is such a busy place, meeting upon meeting. So if the DVC say I'm in a meeting, that meeting may not be the only meeting. From that meeting to another meeting to another meeting to another meeting. So to leave all these meetings, leave all the administrative work to be here, to deliver lecture, is a sacrifice. And we appreciate that sacrifice. My HOD, I don't take it lightly. Thank you for coming. We appreciate your presence. In fact, his presence alone makes this program dignified. Having said that, I want to call on Mr. Stowe Wada, who is the South Regional Councillor. The way the HBTSSN is structured is that every region has a regional councillor, and he represents the South, which is made up of 6 states. So I want to give him the opportunity to say a few words to us, vote of thanks, and then after that we just go out and take our pictures. Thank you.
Thank you, Prof. Prof has thanked everybody in this hall, but I want to thank you again. Our President, I want to thank you most profusely for your efforts in organizing us. I want to thank the media for putting us online. Our HOD, thank you very much for coming. I want to use this opportunity to thank our sponsors, Narayana Health, Clina, Lancet, Analytics. They have agreed to join us next year to also sponsor this program next year. And I want to urge all of you that we have to plan together to make sure that next year's event comes up better than what we have today. I pray that the Almighty God will help us to push HBTSSN further than what it is today. Thank you very much. Thank you for coming.
Yes, ladies and gentlemen, I sincerely want to appreciate every one of us for staying behind, start this program, and now it comes to a conclusive end. I want to appreciate every one of you on behalf of the society and also inform you that we'll be taking the group photograph outside. So please, let's make ourselves available outside for the group photograph. It's important. The group photograph is like sharing the grace. So let's meet outside for the group photograph. So let's meet outside for the group photograph. We are meeting outside now for the group photograph. Please permit me, we'll take a closing prayer while we are going for the other photographs. So please stand in the first closing prayer. Thank you.
Thank you. Let us stand up. Are you not tired? In Jesus' name, Heavenly Father, we thank you for this wonderful opportunity to gather and learn and increase in our knowledge and our understanding. We appreciate your holy name. We say all the people that came here today, they are going to go in peace in Jesus' name. Wherever destination they have come from, they shall return back to their destination peacefully and glory to your name in Jesus' name. Let us share the grace of Jesus Christ, the love of God, and sweet fellowship of the Holy Spirit. Let's abide with us now forever. And in Jesus' name we pray.
taking you a long time. I have other things I want to go and do.
Okay, start. Hello and welcome. My name is Cynthia Ogowike from Solve TV. This is a live broadcast from the College of Medical Sciences, River State University. And today is considered the World Thrombosis Day. And we've been here learning about thrombosis and how to prevent it. Here with me is Professor Z.A. Jeremiah, the President, HBTSSN. You're welcome, sir.
Thank you.
I noticed that this program is hosted every year. What's the essence?
Yeah. Massage the place, or we attribute it to somebody in the village, somebody who is somewhere doing, sending charms and all the rest. And somebody will say, I have poison, my leg is weak. And it's a silent killer. So the essence of this is to make people aware that there is something like this that kills silently. And then it's also preventable if we adopt a healthy lifestyle and take precautions.
Thank you very much, sir. Okay, how is this thrombosis prevented?
If you were in you heard so many lecturers who have said a lot of things. The incidence of this thrombosis is higher among people who are immobile, hospital patients who are hospitalized for a long time, sitting down for a long time, traveling on the road, you put your leg down, sit down one place for a very long time, flight. All this can predispose somebody to thrombosis. Anything that can make blood either to stop flowing or to flow very slowly can result to thrombosis. So one of the best things to do is to make sure that even if you are sitting down, even in the office, just as we were taught here, you just have to make sure that you move your legs, move yourself. You don't have to be sedentary, sit down one place for a very long time. How to prevent it. And there are many other things that have been said. If you are in a family and you discover that, oh, my father had similar problem like this, leg pain, swelling, he died and all that, you can begin to watch out. It may be genetic, maybe it runs in the family, because it can also be acquired genetically. You can also avoid smoking, avoid overweight, because diabetes is also a risk factor. Hypertension is a risk factor. Smoking is a risk factor. All these things, if you avoid them, you can be sure you avoid thrombosis.
Thank you very much, sir. Counselor, Professor Stowe Okwada. You're welcome, sir.
Thank you.
Okay, sir. So, it was said here that thrombosis is a silent killer. What measures can one take to prevent thrombosis?
Yes, the measure to take to prevent thrombosis is to be exercising, to be mobile. You don't sit at a place for too long. You drink water. You change lifestyle. Your lifestyle should change. You have to exercise yourself. Those are the simple measures that you take to prevent thrombosis. You don't sit at a place for too long. Thank you.
Thank you very much, sir. That'll be all. When is that best today? And blood transfusion science. Please, for the sake of the viewers, can you tell us your name?
My name is Chinemerem Cynthia.
Okay, we've been here and we've learned a lot about thrombosis. Can I ask, what is thrombosis?
Actually, it's a medical condition in which there is a blood clot, and when there is this blood clot, it can actually lead to swelling of that area, which is usually bad. And many people don't know about this because it's actually not being told to the people. But it's a silent killer, and I'm glad we did this program today because it has actually enlightened people that thrombosis is actually a silent disease.
Okay, how do you help yourself and others to prevent thrombosis?
What we need here is sensitization, telling people, going out and telling our friends, and using social media. Today, social media, everybody accesses their phone every minute. So it begins with me and other professionals who are in the healthcare session, telling individuals and our friends about thrombosis, because we here in the education center, we are already enlightened, but we need people out there who don't know about thrombosis to know more about it.
Thank you very much.